Okay, Assalamualaikum and very good morning to professors, doctors, and all participants. My pleasure to be the moderator of the symposium today. The showcase, the showcase of Advanced Health and Medicine Research Clusters Symposium. On behalf of the organizer, we wish to extend our warm welcome. And thank you to all professors, doctors, and participants. Okay, so we have a 10 presentation today. Okay, it's all about the scope, the introduction, and also the research activities of the research cluster. Okay, so without further delay, I would like to read a bit short biography of the first group, the Vision and I Research Group, headed by the Associate Professor Dr. Wan Haslina Wan Abdul Halim. Dr. Wan Haslina is a consultant ophthalmologist in the Hospital for Perubatan in Pasar, Malaysia, specializing in cornea and anterior segment. She received ophthalmology training from National University of Malaysia in 2008 and pursued a doctorate degree in visual science from the Birmingham, United Kingdom. She was appointed as a British Contact Lens Association of Fellow in 2014, and she then successfully graduated with a PhD in 2017. Her doctorate research was a corneal biomechanics assessment and its effect on colorimetry study in a normal glaucoma as well as a keratoconus population. So without further ado, I will like to invite Professor Dr. Wan Haslina Wan Abdul Halim to present his group research.
Assalamualaikum warahmatullahi wabarakatuh, and very good morning to everybody. Oh, I'm sorry, there's a pop-up here. So, okay. I would first thank the chairperson for the gracious introduction. And let me first begin the session with the introduction of Eye and Vision Research Group in the Ophthalmology Department, UKM, sorry. So Ophthalmology Department, UKM, started in 1977, the day I was born. So it is founded by one of our pioneer, which is Dr. Haji Muhammad Normal Hakim, in which we still dedicate one seminar room in his name. And we have produced more than 300, I think latest will be about 400 plus eye specialists around Malaysia or all over Malaysia. And our team consists of 15 lecturers and 14 lecturers and also training lecturer. And we have optometrists with us, we have research officers, medical lab technologists, and also support staff. So people say tak kenal maka tak cinta, right? So this is to introduce our faculty members. We have glaucoma consultant, two glaucoma consultant in our team, which is Prof. Shamsia, Prof. Jemaimah, and others each have one consultant in charge. One is pediatric ophthalmology, Dr. Safinas, vitreal retina unit, Professor Melin, me as a cornea and anterior segment in unit, and also Dr. Uthmaliza in oculoplastic. There are the other lecturers and junior lecturers are in specializing in general ophthalmology. So what is our clinical setting? Just to give you an overview, what do we have in our department that makes us able to perform our research activities? Yeah. So we have we offer outpatient services where the eye clinic, which is our outpatient clinic, is located in the first floor of the hospital building and capable of sitting at one time 160 patients. Actually, we do have more than 160 patients in a day, but there are extra sittings, and we have staggered timing slots to make sure that there's not too many patients at one time. So we also have our ophthalmology ward located in the 5th floor with a bed capacity of 28. But I think now we have expanded our service in terms of servicing patient who has daycare appointment, and we have now a daycare ophthalmology ward located just beside the ophthalmology ward. And in terms of operation or surgeries, we have 2 operating theatre which sees more than 1,000 eye operations per year. And this is not only doing cataracts, but also subspecialized surgeries such as cornea transplants and glaucoma drainage device implants, and etc. So our clinical setting has enabled us to perform clinical research, not only with clinical outcome, but more also on visual related research setting. So this is just a picture to just introduce you the situation in our clinic. You see there's a large crowd there, but these are the sources of how would I say, subjects and volunteers for our research. And we do have optometry service, and also all the other visual diagnostics devices. For your information, our eye clinic is very much equipped with most up-to-date facilities. We have spectrodome in OCT, and I think we have the latest OCT machine since then. We have retinal tomography and angiography device, and we also have the latest laser machine to make sure that our service is up-to-date, and also able to service the patient better. And we have confocal microscope, electrophysiology equipment. We have also all corneal diagnostic devices such as Pentacam, Keratograph 5, and Corbis ST. And these are looking into more advanced diagnosis of corneal problems. So in terms of operating theatre, we have 2 operating theatre with latest phacoemulsification and vitrectomy machine. We always make sure that our instruments are all up to date, and if there is any problem, we have the cooperation of the industry to make sure that we give optimized service, surgical service. And we have other additional machines such as endoscopic cyclophotocoagulation machine, indirect laser machinery, which may not be able in other hospitals, but it is available in our setting. So just to give you a brief view of what we are servicing, not only we are doing clinical service, but we are also servicing in terms of training eye specialists, ophthalmologists. So what we do is we train them for 4 years. It's either in campus or out campus. So from here, we have, I would say, a very large source of research student. Okay, so every year we have about 15 to 20 intakes, and from these students are being supervised in terms of their research, because at the end of their 4th year they are obliged to submit their research dissertation in order to pass their ophthalmology training. So just to lay out the members of the research group. The research group is consisting of not only the ophthalmology department lecturers, but it also consists of allied members. So other allied members, mostly from the faculty, and we have here from engineering faculty, and Dr. Kalaivani Chalapan is from engineering. I'm sorry if I missed some, but these are the key co-researchers that are working very much close to us in terms of making sure that our research is a success. So Prof. Dr. Nuzana from Anatomy, Professor Angela from CETM, and Professor Muhammad Fauzi as well, and Dr. Idayu from JKM, and of course Prof. Nur Azian from UMBI. So I'm sorry if I don't mention all the allied health members, but we also do cross-department research. So we do have collaborators from other departments in our medical faculty, and alhamdulillah, the quality of research has risen up very remarkably since we do collaboration with our allied members. Yeah. So well, our research group is largely divided into one experimental, clinical, and epidemiological. But we also have one more, which is animal study. So the animal study is being performed in our department, mostly on conjunctival, cornea, and retina areas. Yeah? So the experimental study is being done where there is genetic study, tissue engineering research, and also stem cell research. We also have clinical study where we do drug trials, and we do randomized control trials, not only on insulin eye drop, but also on umbilical cord blood serum. Okay, and we also do many clinical trials that testing drugs use in the eye. So the epidemiological study that we do is not only case control and cross-sectional, we also do a large-scale population-based study. So at the moment, the collaboration is more with other centers such as optometry unit, optometry faculty, and Faculty of Science, Science Health, and in terms of clinical trial in animal study. We do both mainly in-house, which is between collaboration between ophthalmology department as well as CETM, the tissue engineering center. So what laboratory that we worked with? So as I said just now, we do work together with UMBI on genomic, biobank, metabolics, and proteomics, and with tissue engineering center in terms of cell culture, stem cell study, animal biobubble, and also in vivo imaging. Then we also work very closely with Faculty of Engineering, UKM, but I think we also work quite closely. We have worked before with engineering department from GMI, German Malaysian Institute, and other center. So we look at medical devices, cardiovascular, ocular, vascular engineering, and also health management. So just to recap a bit about our stem cell research. So far we have a very nice team where each of these lecturers look at different areas. And Prof. Jemima is actually leading in terms of conjunctival stem cell study, regeneration and stem cell study. And I'm more to cornea regeneration and limbal stem cell research. So we do have create animal model with limbal stem cell disease, and at the moment there are, I think, about 2 or 3 industry that are interested to test their drugs on our limbal stem cell model. So the other one is optic nerve and retina, led by Prof. Maylin, where she looked at simulated models of injury on the retina and how to treat them. Okay, so from our study and research, we actually come up with many on innovation. I would say that some of them is still in TRF 4, 5, and some is actually 6 and 7. So to help the blind to read is also one of the innovation that was initiated by Professor Musha Wiyati, who sadly left us, retired, sorry, so already retired, and smart medicine dispenser system, where we are looking at easing the patient in terms of storing their and making sure that they adhere to their eye drop and medication. So other than that, we also have virtual reality cataract surgery simulation product, where we are looking into the future of industrial revolution, where we want to train our student first with virtual reality simulation before they ever touch patient's eye. So this will enhance their ability to able to do surgery better and reduce the outcome or reduce unfavorable outcome or complication. So the other one is synthetic eye model for cataract surgery training. So we are looking at improving teaching and learning in terms of cataract surgery by also making an eye model. So before this, what we do is we get organic eye, such as a goat's eye or a cow's eye to do training on. But now we are innovating in terms of making a synthetic eye model so that we can also improve the way we teach cataract surgery for our trainees. Other than that, there are also innovation led by Prof. Jemima, where she developed a teleglaucoma program, and this I think has been patented, where we are the patient making sure that patient does not miss their appointment and follow up, so that the doctors can monitor the patient well and reduce unfavorable or complication from not treating or not being monitored in terms of the follow-up and treatment. And the other one is glaucoma virtual clinic, and this is also led by Prof. Jemima. So basically, these are the telemedicine product that we have produced in our department. So many of the research grants for us to be able to perform or carry out our activities, we need research grants, as we know. So we are helped very much by the faculty funding, and at the moment we also have lecturers who have also received research university grants, and Ministry of Higher Education we have lecturers with FRGS grants, and Ministry of Science and Technology we have received science fund in terms of making sure that our product or innovation goes further. Okay? So in terms of industry, we are working very closely with industry, where we have all the investors, and I won't say investors, I would say sponsors. Yeah. So these research grants are being granted by all this industry to ensure that to support this research activities, and also to further enhance the output of our research. So we are very grateful to all the research industry that is willing to collaborate with us. So far, the track record has been good, and we are gaining trust. And now I think we have more and more industry who are interested to do research studies with us. So we have attained many MOU, MOA, and research agreement, and Indonesia is also one of our counterpart, and we also have RANSCO in Australia and New Zealand Ophthalmology Society to be in our MOU. So publications wise, we have increased our publication for the past 5 years, and I would be proud to say that our team has always attained the KPI set by the faculty. So publications in high impact journals are now coming more and more. And we also, as I said, we have national linkages with many local institutions and bodies. And we also have international linkages, as I mentioned just now. And industrial linkages as displayed here. So I just want to first touch in a little bit about our key research leaders. So Prof. Maylene is one of our key research leaders with interest in retina, stem cell, and tissue engineering, insulin eye drop, and ocular surface wound healing studies. You can know more about her by scanning the 𝐸𝐞𝐚 Sarjana, and you can look at her research activities and achievement. So type 𝐸𝐞𝐚 Sarjana and Professor Maylene, and you will see her many projects at the moment. So Professor Jemima is also one of our key leader with research interest of health services, outcome in research in glaucoma and diabetic retinopathy, and also Internet of Things. And Prof. Shamsia is very much into management of secondary glaucoma and glaucoma imaging, and I think she's also into biomechanics study in patients with glaucoma. So me as one of the researcher in the team is very much into cornea transplant, corneal and limbal stem cell regeneration, corneal biomechanics, diabetic retinopathy clinical studies, cornea donation awareness and education, plus any visual science studies. So Prof. Safinas is also into our research group, where her research interest is in childhood eye diseases, children health advocacy, education, and I believe myopia. Okay, so these are the future plans where we want to make sure that we upscale our production and marketing of our innovative products, and we would like to collaborate more with the industry and international research body. Okay, should you be interested to contact us with about any research collaboration or a cooperation, please do email me at this email. Thank you.
Okay, thank you, Professor Dr. Wan Hasina.
Thank you.
For the presentation. Okay, so we shall proceed our symposium to the next group. Next group is the sorry. Okay, next group is the drug efficacy and safety research group, led by Professor Dr. Naina Muhammad. So I believe the biography is short. Okay. Professor Dr. Naina Muhammad is professor in a medical faculty, UKM, graduated with distinction in medicine from UKM in 2003 and joined UKM as a medical lecturer in 2005. He completed his master in clinical pharmacology and doctoral studies in medicine and therapeutics at the University of Aberdeen in 2006 and 2011 respectively. Upon return to Malaysia and UKM, he was invited to join UK Bone Metabolism Research and Cardiovascular Research team. He would later establish and head the UKM Pharmacoepidemiology and Drug Safety Unit and the UKM Drugs Efficacy and Safety Research Groups. Without further delay, I would like to invite Professor Dr. Naina to give his presentation.
Right, thank you very much, Dr. Haikal. Assalamualaikum. Thank you for the gracious introduction. But actually, I guess this morning's talk doesn't really revolves around me. So I'd like to share what we do for the research group. It doesn't look right, sorry. Okay, is the slide full screen? Is it okay?
Yes.
The slides are okay. All right. Thank you very much again to Haikal. So I'm here to just share on the research group, drug efficacy and safety research group. Okay, so just a little bit background on our research group. We are actually, I guess, I would say the youngest research group. So we just established in June 2022. However, we are a new research group, but actually we consist of three very well researched entities for a long time. So it's a combination of between the antimicrobial stewardship unit (AMS) with the hospital chancellor HDN, Tuan Gung Chris, and then with the faculty is a combination between pharmacoepidemiology and drug safety units, and also our addiction research and recovery group (ARG). So what happened is basically when we talk about, for example, AMS, I guess we are almost 8 years now, maybe 7-8 years. And then for the pharmacovigilance and drug safety unit, 10 years. And then for the ARG, maybe we are looking at around 5 to 6 years. So what happened is in between June, I would say maybe early this year and up to June 2022, we decided to come together, the three different research and also units, and to form the drug efficacy and safety research unit, research group. So it's basically all three, and we had a discussion, and then we agree, and then we come together to form one big research group, so that we can combine our resources, our personnel, and then work towards a better pathway. And actually, even prior to the establishment of this research group, frequently we had cross research by the teams. So we thought that why, and the personnel, actually most of the research group members are actually either one or two, or sometimes even all three of the separate research unit. So we thought, why not just let's combine together and create a new research group, and that's how the research group was born. So who is in the team? So the team, we have quite a number, because as I mentioned, we have expertise from the hospital, and then two specific research group from the faculty. So we have a clinical pharmacologist, which is myself. We have scientists, we have neuroscientists, we have family medicine specialists, we have psychiatrists, public health, statistician, microbiologists, internal medicine specialists, infection control, pharmacists, anesthesiologists, and the list goes on. We also have our postdoctoral, we have our research officers, science officer, and of course, students. So if we look at our team, we are quite big. It's basically 3 research teams to 1. And even then, I couldn't fit quite a number of our team members are not in the picture, because as I mentioned, we just recently formed about 2 months ago. Okay, so I'll just give a quick overview. I mean, I can't really talk on each research and things like that, because it will be quite a number. But let's go on the sub research units, and then we will, I will just go through what we are doing. So for the addiction research, we have research in alcohol. We have one of the foremost alcohol neuroscientists, Professor Dr. Jaya, in the group. And even myself, we work a lot on alcohol, and we have published many papers on that. We are currently having a project as well on this front. We also look at neuroscience, genetics, epidemiology, treatment. As I mentioned, we have a few neuroscientists in our group. Smoking, we have a foremost smoking expert in our group as well, Dr. Rashidi from family medicine, and he not only conducts research, but also stop smoking clinic for the HCTN. Substance abuse, that's one of my area, where we do a lot of research on CNS stimulants, amphetamines, inhalants, CNS depressants, and etc. Actually, we just went to a conference 2 weeks ago on substance abuse in Malaysia, and we produce about maybe at least 2 or 3 papers on substance abuse every year. We also look at social media addiction, especially in the internet addiction, and we have published some paper on that as well. And of course, epidemiology. So it's one of our basic research in addiction, looking at the various epidemiology and addiction in Malaysia. We also actually have close collaboration with Hussein and also AADK, which I have forgot to mention here. Pharmacovigilance and drug safety unit. So it's one of our component as well. So this unit is actually headed previously by myself, and we focus on pharmacovigilance. We look a lot. So you can see there is slight overlap here, pharmacovigilance and AMS. So AMS is part of pharmacovigilance. And then we have a lot of antimicrobial research, looking at antimicrobial usage in the hospital, in KL, and also in Malaysia. We had one of the largest GP research, general practitioner research done in Malaysia, looking at reporting, and how what are the reporting rates for general practitioners, and what are the common adverse drug reaction that they encounter in their practice. We do a lot of clinical trials as well. I guess we have conducted 3 clinical trials and also maybe participated in at least 5 more other clinical trials. So we have involved ourselves in, I guess, maybe 8 to 10 clinical trials. We are currently actively, we just completed 1 clinical trial with a grant of 1.6 million, and we also just got another clinical trial approved with a budget of 1.2 million, and hopefully we should start that later in the year, this year as well. Of course, we are also involved in drug development, basically bringing ideas, product, especially traditional and herbal medicine, from the lab to the market. That's where we come in. And in this area, we have involved ourselves in developing drugs for bone metabolism, cardiovascular, wound. All right. Actually, we are meeting one company this Friday with our patent on wound, and hopefully it will be out in the market soon. Lipid research, and even cognitive research. So we have quite a number of research in the pipeline for drug development. We also look at pharmacoeconomics. Pharmacoeconomics basically looking at cost effectiveness and cost ratio and etc. In the practice, and of course pharmacoepidemiology, our basic research, looking at a wide variety. I can't really mention quite a number. From anti-diabetic drugs, lipid drugs, antihypertensive drugs, antimicrobial, antibiotics, and etc. So we have looked at that, looking at the usage pattern, prescribing pattern, and etc. Adverse drug reaction, side effects, ADR, what other systems used in hospital, how, and etc. So many when we talk about pharmacoepidemiology, we have done many research on this area. So what about AMS? So another unit that is a combination in our research group. So it's an active service unit with HCTM. So in the hospital, we do antibiotics rounds. I'm also part of the AMS group. We have CME at least once a month. Maybe some of you have attended the CME conducted by us. We come up with antibiotic guidelines for the hospital, surgical prophylaxis, and etc. And of course, we have AMS programs, reduction of multi-drug resistant organism, monitoring of broad-spectrum antibiotics usage. We have our antibiotic rounds, and we also monitor especially broad-spectrum antibiotics like cephalosporin usage. We have our census audits, infection control is also with us, and many others. But of course, this is basically the servicing side. So not really part of the research group, but of course it's important because when we have the servicing side, it's easier for us to utilize the expertise, the rounds, the programs, and the wards, and etc. for our research. So for AMS, the main research component is actually we look at antibiotic usage and audits. We do that almost all the time. Antibiotic prophylaxis, we have a main project with currently ongoing with and also Pfizer as our sponsor, looking at surgical antibiotic prophylaxis, on the usage of antibiotics, whether it's appropriate or not, whether the timing is correct, whether the dosing is correct, and etc. And mainly whether sometimes even simple thing is whether the use of the drug, is it properly documented? And that's one main problem that we notice. Of course, we also look at rapid diagnostics, whether it helps with prescribing. So we just started this project looking at rapid diagnostics. Where we at the moment, if you send for blood culture to identify organism, you will get the result within 48 to 72 hours. So our aim is actually reduce that to 24 hours, and if we are able to cut cut down the time to 20 by at least 1 day, by at least 24 hours. So what will that impact be? So especially in ICU setting, sometimes in a patient with severe problems and severe burden of disease, if you're able to cut down the identification of the organism by 1 day, will it have effect on the outcome of the patient? And of course, when we look at that, we also look at cost and etc. So we also have septicemia and a lot of research in broad spectrum antibiotics, as I mentioned. We are currently, one paper is currently being reviewed with minor corrections, and hopefully it should be published soon in the Journal of Antibiotics. So what is our strength, our research group strength? So we are among the largest research group, not surprising because it's basically a combination of 3 research groups in one. We have a lot of prominent and forefront members. As I mentioned, we have the main member for smoking, alcohol, infectious disease, microbiology, and etc. Family medicine, community medicine, addiction research. So basically, quite a large number of research members. We have very high research grants currently active. So I'm not talking about all research grants. I'm just talking about currently active grants. We have over 3 million ringgit in combination. So we are the only research group with a full-time postdoctoral and a research officer or a statistician. So we have 2 full-time members, fully employed, I would say, fully employed using research grant. So we have a postdoctoral and also a research officer who is also a statistician. We have a research. We also the research group. We have proper, fully equipped research office where we have a fully equipped PC. We have 3 PC. We have laser printers, scanners, tidbits, and etc. We have a high number of publications, Q1 and Q2 publications. So usually we have when we talk about Q1 and Q2, for example, just in the year of 2021, we have over 30 Q1 and Q2 publications. Usually on average, if you're talking about all publication, maybe around 40 to 50 publications every year. We have a high number of postgraduate students, not surprising because of the high number of our research group members. And we have a very good synergy between clinicians and non-clinicians. I would say, actually, maybe around 65, 35 or 60-40 between clinicians and non-clinician ratio. So it's a good number, and we work very well with each other. As I mentioned, even prior to the formation of the research group, each of our individual research unit, we actually already working closely with each other and working well, and therefore, why we thought of why not just let's come together and form this research group. So I guess I don't want to take too much of the time. Basically, just a brief overview on what is drug efficacy and safety research group. Do feel free to join us. As I mentioned, we are a new group. We are always expanding. Feel free to reach out to us. And of course, if you have any collaboration project, any ideas, etc., in any of the areas that I've mentioned, especially if you're looking at drugs, or even not the area that I've mentioned, but if you have anything to do with drug efficacy and safety, please feel free to get in touch, and hopefully we can come up with something. So I guess that's it. Thank you very much. I pass back to Dr. Aika.
Okay, thank you very much, Professor Dr. Isamaina. So we proceed to next group. Okay, next group is neuroscience, neuroimaging, and Suprema group, led by Professor Datin Dr. Norina Muhammad Ibrahim. Professor Dr. Norina Muhammad Ibrahim is a senior consultant neurologist and professor of neurology specializing in movement disorder at UKM Medical Center. In 2007, Dr. Nolina completed a one-year intensive fellowship in movement disorder and Parkinson's disease at the Institute of Neurology, Queen Square, London. She was the head of neurology unit from 2007 to 2011, and later became the head of Department of Medicine, Faculty of Medicine, from 2011 to 2016. Dr. Nolina was also the first chair of Movement Disorder Council of Malaysia from 2010 to 2014, and she is the recipient of the High Impact Grant from UK in 2012 and 2019. Research Award from the Faculty of Medicine in 2016. Anugerah Pitara UKM in 2016. She was the recipient of the Distinguished Graduate Award by Medical Graduate Alumni of UC College Dublin for the year of 2018 and received Excellent Service Award from the faculty in 2010 and 2019. Without further delay, I would like to invite Professor Dr. Nolina Ibrahim for the group research scope and activities.
Thank you very much, Dr. Haikal. Assalamualaikum and a very good morning. Allow me to share my slide. We are the Suprema Neuroscience Neuroimaging Group. So basically, we are a combination of three research groups, and let me share with you who we are exactly. So this neurosciences group is chaired by me, whereas the neuroimaging group is chaired by Professor Dr. Shahizon from the Department of Radiology. The Suprema group is chaired by Professor Dr. Chan Lai Fong from the Department of Psychiatry. We are just a group of clinicians and scientists working together in the field of neurosciences, and the mind. Okay, let me show you our team and collaborators. And you can see that we consist of neurologists, neurosurgeons, and neuroradiologists, including interventional radiologists. And Suprema team is Professor Chan Lai Fong and the team. And our collaborators, we have Dr. Azian from UMBI, Dr. Siti Aisha, and we have neuroscientists, Professor J. Kumar, Professor Susanna, Professor Zurina, who works with us sometimes for some of the projects, Professor Teo, Dr. Fairuz, Dr. Hanafi, and then we have Dr. Fazila who works with us. And we have our collaborators with Faculty of Pharmacy, Dr. Kaisan, Dr. Norazlin from FSK, Prof. Kartini, she's retired, and Dr. Azrul, FMRI, and Dr. Hanani as well. She's also part of our neuroimaging team. And we have various other collaborators. So let me share with you, because we consist of three groups, I have to present each of them separately. So Suprema stands for Suicide Prevention Research in Malaysia. It's chaired by Professor Chan Lai Fong. That's the contact details. And just a snapshot of what has been achieved by Professor Chan Lai Fong. And you can see she has received a Dana Luar from the Malaysian Psychiatric Association for the Media Safe Reporting Workshop. So she's very active in the media and also in the community regarding suicide prevention. And she has also received an international grant from the University of Edinburgh, which is still ongoing, totaling to about 86,000. And she's part of the TRGS grant on the REAL, which is emotional regulation of Malaysian adolescent. And Dr. Chan Lai Fong has been very active, and we know that she's actively published in very high impact journal, and this is a suicide prevention research group. And if anybody is interested, you may contact her on this on her email address if there's interest in working with her regarding suicide, especially in how to prevent, and if there are any collaboration that you're interested, please contact Prof. Chan Lai Fong. And next, we move on to the neuroimaging group. Neuroimaging is a study of the structure and function of the nervous system by means of imaging technology. and it's a non-invasive way of looking at the brain, and it complements a lot of our clinical, clinical diagnosis. And we cannot survive without neuroimaging because it tells us what is the pathology, or at least we cannot get access to the pathology. At least we can see what is the problem with the brain. And the head for this group is Professor Dr. Shahizon Azura. This is just an interesting picture of what neuroimaging can do. And we do have structural imaging, and we have fMRI here, and we also have EEG, and we can do various neuroengineering using neuroimaging technology. So some of our projects are like that, so I'll share with you shortly. So this is a slide shared by Professor Shahizon to show what is happening in the field of neuroimaging. So in the neurodiagnostic team is herself, Dr. Aida and Dr. Faiza. And in the neurointerventional group is Professor Rosman and Dr. Leong. And they are responsible for the stroke thrombectomy. So, and they are doing endovascular research, cerebral aneurysm, flow diverter stents, and vascular malformations. And as you know, UKM is one of the leading centers for stroke, especially in acute stroke treatment. So these are some of the publications by the neuroimaging team. You can see that they have worked with our Faculty of Engineering to develop a way to diagnose intracerebral hemorrhage and various other systematic review. And these are some of the publications that I'm sure there are many more publications. And other projects that are ongoing are neuroimaging in brain tumors, stroke, vessel wall imaging, perfusion studies, and then there's chemical exchange saturation transfer for brain tumors. So this, you can see that we work together with the neuroimaging team. Now I'd like to move on to the neurosciences research group, which forms the biggest group of these trilogy, if you call it, of this three group network. So it's chaired by me, and we are a group of clinicians which consists of neurologists, neurosurgeons, and neuroscientists. And our research is mainly clinical, translational, and some, of course, with the neuroscientists is quite fundamental. And if you just look, as clinicians, we see neurological diseases and neurosurgical diseases. And our neuroscientists here have been working on various diseases in animal models, depression, Parkinson's disease, aging, addiction, and cognition. And these are just a summary of the diseases that are prevalent in UKM and this research that's ongoing. So stroke, Parkinson's disease, epilepsy, ataxia, neuromuscular diseases, small fiber neuropathy, whereas the neurosurgical diseases are traumatic brain injury, spina bifida and brain tumors, gamma knife. We have a gamma knife center, and we can do gamma knifes research, spinal cord injuries. And for the neuroscience projects, there are a lot of elucidating the mechanisms of neuroprotective pathways, looking at tocotrienol rich fractions, gut microbiome, zebrafish models, metabolomics. These are some of the strengths. I've just highlighted the strengths here. And just this is a snapshot of neurosurgery activity that's going on in terms of their research. So you can see that Dr. Palani here has obtained a spina bifida FRGS grant on molecular mechanism of neuroinflammation in a retinoic acid-induced spina bifida mouse model. So this is a very fundamental study conducted by, led by our neurosurgeon, which is very, very nice to see. And then we have also a neurotralogue study, which is on impact of COVID with traumatic, on emergency surgeries, especially on traumatic brain and spinal injuries. So this is a multi-center international study where our team has collaborated. And this NEST registry is a study where we look at the herbal supplement called NeuroAid. It's not herbal, it's now been marketed for spinal cord injuries and brain injuries. And Dr. Ramesh Kumar is leading in that. And he has various publications on that. And you can see some of the papers that has come out from this research. And gamma knife research is also coming because we now have a gamma knife center, and Professor Dato Jagan, Dr. Ramesh, and all the neurosurgeons are involved. And the head of neurosurgery is Professor Dr. Azizi, and he's also involved in all of the research. And this is just to share with you some of the work publication that has come out of the research from neurosurgery team. And as you know, neurosurgeons are very busy, and this is amazing that they have done so much work. And this is, so when we go moving on to neurology, I have to divide it into disease because that's the easiest way of looking at it. So let's start with the stroke research, and the lead for the stroke research is Dr. Lau Zi Kang. He is a primary investigator for investigator-initiated international clinical trial. So he has published very widely in Lancet and on about 𝐇𝐞𝐿, which is an international clinical trial. And this was part of his PhD in University of Nottingham. So it is tranexamic acid in intracerebral hemorrhage. And we have Dr. Wan Ashraf, who is very, very into hyperacute stroke, and he is the principal investigator for another international trial called Trident. And we have Professor Dr. Wan Nur Nafisa, who's our current head of Department of Medicine. She's the primary investigator for mesenchymal stem cell study, which is in pipeline now. We have done the part 1, where I was the primary investigator, but this is now we're going to the second part. This is an industry-led clinical trial. And two of our stroke neurologists have been appointed as selected to be the World Stroke Organization Stroke Future Leader Program. So they have a great vision. And the type of research in stroke has been predominantly clinical, and we like to move towards fundamental or translational. And our stroke research is very much revolves around primary, secondary prevention, where we control of blood pressure, diabetes, anticoagulant, and also in the field of diagnosis of stroke, where we use CT or advanced imaging, and also in the field of acute treatment using thrombolysis, stem cells, and whether we can control intracerebral hemorrhage, BP control, and so on, or any hemostatic treatment such as tranexamic acid, or any complications with regards to stroke. Let me just, these are our international collaborators for stroke, and stroke riskometer is something that we have been working very closely with Professor Valerie Figin, and this was launched in Malaysia, the Malay version, in 2013, if I'm not mistaken, or early 2014, and I was involved in this as a pioneer in bringing stroke riskometer here, and it's now being continued on this project. And I mentioned earlier, Professor Nicola Sprigg and Professor Philip Bath from University of Nottingham, where we still conduct this 𝐇𝐞2 study and 𝐇𝐞3. And Interact, Trident, and Optimus are part of the Georges Institute from University of South Wales, Australia. And the Florey Institute, the AVERT dose is a rehabilitation trial. So it is also an international study. You can see our stroke team is very, very active. And you can see this is the snapshot of all the research projects that's gone ongoing or completed with our stroke team. And they're mainly clinical. And you can see the ongoing, completed, and planning applications. So the ongoing, you can see in green, AVERT dose, post-stroke, and all these. Some of them are master study. Prime and Ribus are international, and intracranial, extracranial are master study. And you can see multi-center, which one of these are multi-center. You can see the AVERT dose involves the rehabilitation team, so it is a multi-center trial and or international trial. And this is interdisciplinary. So we have all you know, the stroke research is quite extensive, as you can see. And let me move on to Parkinson's research, which is my area predominantly, although I have worked in stroke research before. I'm the lead, and Professor Sharul Azmin is another movement disorder neurologist who obtained his PhD from University of Melbourne, and we have a PD nurse, Siti Hajar, and our publications related to Parkinson's disease is more than 50, and predominantly in the initial part were mainly master's project, and we have more than 40 projects. And our projects are mainly interventional. We have some randomized control trials that has been published, and descriptive studies, cross-sectional, retrospective, systematic reviews. And we have in translational studies where we have collaborated with UMBI. We have done biomarker study for cognition, impulse control behavior, where we had looked at the genetic predisposition. And we are now collaborating with the GP2 program, Global Parkinson's Genetic Program, under Michael J. Fox Foundation with Dr. 𝐸𝐞𝐚𝐥𝐭𝐡 from UCL. We also have multidisciplinary projects where Prof. Nur Azlin has involved us for her FRGS grant on educating caregivers on Parkinson's disease. And these are our collaborators, and we have biobanked Parkinson's genetic samples of more than 400 samples since 2006 or 2007. And we have various strong collaborators with University of Malaya, Professor Lim Shenyang and Professor Tan Ai Hui. And this is our industry who sponsored our probiotics. And we're also doing ataxia research, and we're only research center doing spinocerebellar ataxia research in Malaysia. And for this, we have obtained Dana Impact Perdana in the year of 2019, and our PhD student, Mr. Yap, is completing. And we also managed to obtain the MOSTI ICF grant to develop a cerebellar ataxia monitoring system using video kinematics and deep learning. This is ongoing, and our strong collaborators from faculty kejuruteraan Alam Bina is Dr. Gan, and also Dr. Amira, Dr. Azrul from FTSM, and Professor Tang, and our main collaborators, Professor Bart from Radboud University, Netherlands. And this is still ongoing, and this is still new, and we hope we can do more with ataxia. And moving on to epilepsy research, it was started by Emeritus Professor Dr. Raymond Azmanali since the year 1998. And now it's taken over by Professor Tan Hui Jan, who is the head of neurology unit as well, and Dr. 𝐸𝐞𝐴𝐿 who is extremely very dynamic, and he's obtained many research collaborations with his great networking skills. And we now have a total of 80 epilepsy projects in the past and ongoing, and approximately 85,000 worth of university grants cumulatively, and external grants of 395,000. And the projects include traumatic brain injury, EEG, neuropsychology, and epilepsy, depression. Of course, we haven't included everything because it will just take a long time. And Professor Tan has developed an epilepsy app, which has won the Educational Innovation Award. And Dr. 𝐸𝐞𝐚𝐥𝐭 has also obtained GGPM, and our collaborators are in Monash. And there's numerous publications, all in most of it in high impact journal. I haven't listed them. And this moving on to our neuromuscular and peripheral nerve research group, we have the lead by Professor Dr. Rabbani and Ramli. She also obtained an FRGS. Her interest is in small fiber nerve research, and she got a fundamental research grant. And Dr. Ng Chen Fei, who is also a neurophysiologist and neuromuscular expert, and the area of interest is in muscle disorders, peripheral nerve disorders, and motor neuron disease, and where they're part of the National Movement Motor Neuron Disease collaboration with University of Malaya and University Science Malaysia, also part of the National Registry for Motor Neuron Disease, Pan-Asian Committee Treatment for ALS. So there's a lot of interest in neuromuscular research, and especially with the treatment for Pompe disease. You can see that there's an investigator-initiated study here by Sanofi, because there's now new treatment for Pompe disease, and now we are part of the center being involved in the registry for this. And we do have our research supported by our neurology lab, where we have nerve ultrasound and nerve conduction study machine and electromyography machines. And this is a part, it makes our, our study very, make it easy for us to conduct our studies in neuromuscular and peripheral nerve. So what about neuroscientists? We have quite a number of neuroscientists, all very active and dynamic. And you can see here Professor Jaya Kumar from the Department of Physiology. These are just the key words that I extracted from his current research. He has done numerous research, I know, and this is the current ongoing ones. And he's worked on gut microbiome using probiotics, and on bird's nest and Alzheimer's disease in various aspects of it. And also looking at polydrug dependence induced neuroplasticity. Actually, Dr. Jaya's interest is in addiction, and he is also working on gut microbiome, Alzheimer's disease, and bird nest. And he was the recipient, or he led the International Brain Research Organization Neuroscience School on Neuromics last year, which was very, very excellent. and he also doing various other studies, including machine learning. And his publication is also numerous in high impact journals, and I don't have time to include all of them. And the next is our Professor Hanafi Ahmad Damanhuri, who from the Department of Biochemistry. His interest is in cognition and aging and neurodegenerative diseases, and he's done numerous work on Alzheimer's disease, including omics, and current ongoing research project are these two, but he's done so many other research on neurodegenerative diseases, including looking at vitamin E, effects of vitamin E on cognitive decline and so on. And Professor Teo Seong Lin is another neuroscientist who works on a zebrafish model, and his interest is in Parkinson's disease, and he's also currently received the fundamental grant and also FRGS grant, which is still ongoing, and his keywords is Parkinson's disease and zebrafish. So I have to work with Professor Teo together to develop some neuroprotective treatment for Parkinson's disease. And Dr. Fairoz is looking at, this is his current project, which is a GUP project on Alzheimer's disease, Kelulut Hani on Alzheimer's disease, whereas Dr. Tan, he's working on metabolomics. He's from the Department of Biochemistry, Dr. Tan Jen-Kit. He's looking at mitochondrial metabolome in rats with aging, and metabolome of the memory impairment in zebrafish, and then tocotrienol rich fraction on cognitive function, and a supplement on cognitive performance as well. So basically, we can see that a lot of us are working together in some aspects, and the clinicians are predominantly clinical work, but we are together as a group, and we have worked together in numerous projects, and I think we are evolving and developing and getting stronger together. And these are some of the publications in high impact. There are more, but this is what was shared by Dr. Lau Zikang. This is his own publication, and you can see that he's published in all Q1 journal in Struck, and as first author, and also as this is Lancet Neurology, and you can see his name there, and Dr. Jagan as well is part of that, and there's so many others. This is publication by Dr. J, Nutrients and GBD study, which I'm part of. We get publication in Lancet, and because of our collaboration with the Global Burden of Diseases. And this is just to summarize our facilities, team, and grants. We have outpatient services, stroke care unit, video telemetry unit, nerve conduction study, electromyography, TCD, nerve ultrasound, TMS machine. And these are our team as a neurologist, the clinician, and we have grants, various grants. I didn't calculate the amount. And we have international collaborators with many MOU and MOA. We're going to sign an MOU with Monash University, Malaysia. We have local collaborators working with us since 1998. And these are our strategies for enhancing neuroscience research in UKM. Basically, in the last year, we were strengthening multidisciplinary research ecosystem, where we had some focus group brainstorming sessions and interactive sessions. And this year, we are gaining momentum, where we will increase networking and partnership, and with MOUs with industry, NGOs, and obtaining national grants. And inshallah, in the next few years, we will sustain it by increasing our international collaboration, nurturing new talents, and we will hopefully, with our publications, grants, patents, and all that, will bring impact to the society and scientific community. And with that, this is what we hope for, to have our own brain center. And with that, I thank you. If there's any, if you wish to contact any of us, you can email me, or you can email all the leads in each of the subgroup. With that, thank you.
Okay, thank you, Prof. Dr. Nolina, for the precise presentation. So we proceed to our next group, the Aging and Degenerative Disease group, led by Professor Dr. Suzana Makpul. Professor Suzana is a professor in biochemistry in Faculty of Medicine, UKM. Graduated from University of Malaysia with Bachelor of Science, HONS, in 1992, and obtained PhD, medical biochemistry from the same university in 1997. She went to Graduate School of Pharmaceutical Science, Hokkaido University, Japan in 2000, and then following Institute, Oregon, USA in 2008 for research attachment. Without further delay, I would like to invite Professor Susanna to present his research group activities and scope. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and good morning. Thank you, Dr. Haikal, for the kind introduction. So let me share my screen first. So can you all see my slides?
Cannot, Prof. We cannot see your slide.
Okay, maybe I stop sharing for a while and then I reshare. Okay. Can you all see?
Yes, Prof. Yes.
Okay. But I just wondered, I already, okay. Slideshow, is it already in the slideshow mode?
Not yet, Prof. I think your internet connection is not so good.
Yeah, most probably. Just hold on, yeah. Okay. So our research group is Aging and Degenerative Diseases Research Group. And this is the list of members in the group. We have Professor Dr. Nozana Abdul Ghaffar from Department of Anatomy, Professor Dr. Zulkifli Mat Zainuddin, Associate Professor Dr. Azman Abdullah, Associate Professor Dr. Gunjo N, Associate Professor Dr. Chua Kien Hui, Associate Professor Dr. Muhammad Hanafi Ahmad Damanhuri, Associate Professor Dr. Siti Fatimah Ibrahim, Associate Professor Dr. Jamari Sapuan, Associate Professor Dr. Rabani Ramli, Associate Professor Dr. Aznida Filza Abdul Aziz, Associate Professor Dr. Nolaili Muhammad Tohid, Associate Professor Dr. Chan Lai Fong, Dr. Nur Akmal Sharila, Dr. Kaizurin, Dr. Ikram, Dr. Tanjen Kit, Dr. Muhammad Luqman Nasaruddin, Dr. Nur Wahidah, Dr. Liu Woon Sai Cheng, Dr. Fairuz Ali, Dr. Yoh Chih Ni, Dr. Zainah Muhammad, Dr. Osman Liza, Dr. Hashim, Dr. Lau, Dr. Manira, Dr. Muhammad Dain, Dr. Atika Haizum, Dr. Farah Hanan, Dr. Mariati from Faculty of Dentistry, Dr. Ismailiza, and Dr. Muhammad Amir Kamaruzaman. So besides these key researchers, of course, we also have the support from the research officer and scientific officer, as well as the technicians and also postgraduate students. So as I already mentioned, the department members come from various departments here, such as biochemistry, pharmacology, physiology, anatomy, Department of Medicine, Family Medicine, Orthopedic, Psychiatry, Emergency Medicine, Surgery, Anesthesiology and Intensive Care, Tissue Engineering Center, and also Craniofacial Diagnostics and Biosciences from Faculty of Dentistry. So these are the key members of the research group, and they are doing various types of research. So among the research focus, as shown in this slide, I'm not going to show the detailed research conducted by each researcher, but only highlighting the research focus of the members in the group. So the first one is on cellular senescence or cellular aging. This is mainly done by myself. Okay, I'm focusing on cellular senescence or cellular aging, or is also known as replicative senescence, by using different types of in vitro model. The group member is also using various types of antioxidants as an intervention for aging. So there are different natural products that are used by the research team to delay or prevent aging. And these antioxidants are natural products or antioxidants that are available commercially. Molecular neuroscience is another research focus. So many of us in the group are studying the neuroscience aspects of aging by using in vitro model as well as in vivo by using animal model. So in terms of the platforms, we are using proteomics, metabolomics, and lipidomics platforms using the Orbitrap LCMS system that is available in the biochemistry department. Some of our research team also is doing wound healing and also molecular bone biology and pathology, as well as the stem cell and regenerative medicine and tissue engineering, which are mainly the research focus of the research members from Tissue Engineering Center. Another focus which is very current, I think, is the mitochondrial research. So some of us is also doing measuring mitochondrial function in relation to energy production. So in terms of the instruments, we have got Ouroboros system, which can be used to measure membrane potential, but of course other research method also can be used to measure mitochondrial function, such as by using ELISA technique. Our research member from the physiology department, their focus is on reproduction, reproduction, aging, okay? And also healthy aging is also another research focus that is mainly done by the research member from the family medicine department. Clinical rehabilitation is another aspect that is currently being researched. Mental health and suicidal behavior, these are the two research focus that is being carried out by the research member from the Secretariat department. Other research focus that we are currently focusing are primary care, chronic care, longer term stroke care, stroke management. So this is actually being carried out by one of the researchers from the family medicine department. So finally, it's about the neuromuscular and neuroimmunology disorders. Okay, and this normally is currently done in the clinical settings, okay, by using our patients. For the preclinical study, there are various types of aging model that the research group has developed. Okay, the first one is the human diploid fibroblast cells, which are derived from the skin of 9 to 12-year-old boys. So this is actually the primary culture of human diploid fibroblasts, and this model is commonly used to study the molecular mechanism of aging, as well as can be used to study the effect of intervention, especially if we are focusing on the replicative senescence or cellular senescence of human aging. So besides human diploid fibroblasts, we also have the worms, which is the C. elegans. So this C. elegans represents, in terms of the characteristic of the worms, it represents a human. So it can also be used as one of the model to study aging. So besides C. elegans, which is the worm, we can also use yeast. So yeast is also available and is being used as one of the models in our study, Saccharomyces cerevisiae, okay, which is available in our lab, okay, and can be used as one of the models. Cardiomyocytes, okay, cardiomyocyte, which is also derived from the heart of the animal. So this model has also been optimized and can be used as one of the aging model to study the molecular mechanism as well as for the intervention. So other than the in vitro model, we also have the animal model. So we currently use either mouse or rats. So for rats, normally the rats will be divided into 3 different age groups, which are rats are kept at 9 months old, and also 3 months old, as well as 21-month-old, which are equivalent to the human age. Okay? And 3 months old is equivalent to 20 years old human, while 9-month-olds of rat equivalent to above 35-year-old humans, and the 21-year-old rats is equivalent to 60 years old human. So besides the rats, for the in vivo study, we have also setting up a small lab, okay, for the zebrafish. So this zebrafish is another in vivo model that is available in our lab and can be used to study aging. So another in vitro model that we have developed is the human myoblast cells. So human myoblast also show similar characteristic as human diaploid fibroblast, whereby these cells can undergo replicative senescence or cellular senescence after a certain number of population doubling. And of course, besides the in vitro study and the in vivo study, we are also currently doing human study. So at the moment, we have 3 clinical trials ongoing by using the tocotrienol rich fraction as well as ginger active compounds, which are given to human subjects aged between 35 to 50 years old, as well as human subjects with age above 50 years old. So these are the different types of models that are available. And of course, if anybody is interested to study aging or to study any compound, you can always join us, okay? And we can always share, because these are readily available, okay, in the lab. So in terms of the natural products, because we are studying the effect of antioxidants on aging, so these are the different types of natural products that currently used in the ongoing study. So we have ginger or Zingiber officinale, yeah, Chlorella vulgaris, which is algae that can be easily found in pond, but we have our system that we can culture the algae in the lab. Therefore, it can be used in our study. And besides ginger and Chlorella vulgaris, we are also using honey. But of course, for honey, there are different types of honey that can be used. Okay, and because the honey can come from different type of flowers. Okay, and besides ginger, the algae, Chlorella vulgaris, and honey, of course, the main product or the main compound that we are studying is actually tocotrienol rich fraction, or our palm tocotrienol rich fraction. So for the study with tocotrienol rich fraction, currently we are collaborating with SIME-DABI, as well as with Davos Life Science Singapore, and also with MPOB. And besides the ginger, honey, chlorella vulgaris, and palm tocotrienol, some of the research member is also using bird's nest as the compound to delay aging or to prevent aging and degenerative diseases. So this is our strength. We have got many research grants, and I'm showing only the active research grant that we have for the year 2021 and 2022. So because the target is for all research members to have at least one research university grant, and also to have at least one outside grant, maybe the grant from the ministry. So that is the minimum for the research member to try to achieve. Okay, and in terms of the amount, okay, we have GGPM or Grant Galakkan Pendidik Muda. Two of our research members is currently having GGPM research grant with the amount of 79,000. 16 of our research members have received or currently having the grant fundamental Fakulti Perubatan or the FFF grant. One of us have received the Dana Padanan Kolaborasi, and also one Dana Impak Perdana. This grant ganjaran penerbitan is based, this depends on the number of publications. So 16 of us actually have got grant ganjaran penerbitan. For GUP, we have 2 GUP's grant and 1 undergraduate grant or Mutiara grant for the undergraduate research. For the grant outside of the university, so 9 of the research members have got the FRGS grant with the total amount of 1.4 million, and also we have 1 researcher who has got PRGS grant or prototype research grant scheme. And we are also very fortunate to receive 1 research grant from the industry, and they give us 966,000. Okay, so this is actually the collaboration that we have with Davos Life Science Singapore, or in Malaysia, the Davos Life Science is represented by KLK Oleo Malaysia. So therefore, the total current grant that the research group is holding is actually roughly around 3.6 million. For the year, in terms of the output, okay, for the year 2021, our research group members managed to publish 120 papers. So out that 120 papers, 30 papers were actually published in Q1 journal. Okay, another 32 were published in Q2 journal, 5 in Q3, and 12 in Q4. Therefore, this number, 62, 74, 79, okay, 79 out of 120 were actually published in journals indexed in Web of Science, while the balance are published in Scopus or maybe in the different, but not in the Web of Science journals. So these are the examples of papers, okay, published in Q1 journals. In terms of the collaborators and grant funders, we have been working together with the SIMDABI, okay, which represent the industry for quite some time already. Okay. SIMDABI Berhad. We also have collaborators from Malaysian Japan International Institute of Technology or MJIIT, Miracle Berhad, one of the local collaborator, KLK Oleo or Davos Life Science, as I mentioned earlier. We also have an active collaboration with Institute for Research in Biomedicine from Barcelona, Spain, as well as with Ouroboros Instruments. So these Ouroboros Instruments are the company that supplied the machine for the mitochondrial function analysis. On top of the collaborator, of course, we have got the local funder, okay, the grant from our university, UKM, as well as from KPT and MOSTI. Okay, so these are some of our research activities. Okay, we have like meetings, okay, or discussion with the collaborators, with Samdabi Berhad, okay, here with the Davos Lab Science. So from time to time, we set a progress meeting to discuss the progress of the research. And this one with Miracle Berhad. And just recently, we plan to work together with Euglena company from Japan. And this Euglena was introduced to us by LiveNS, okay? LiveNS. So, but the process is still ongoing, and we hope that there is a positive news from Euglena later in terms of funding, so that we can work together. So other research activities are conducted by the research group. Okay, we just an example here. We conducted a mitochondrial workshop with Ouroboros instrument, and the co-founder of the Ouroboros instrument himself, okay, Professor Dr. 𝐸𝐜𝐼𝐜𝐼, came to our department to conduct the workshop on mitochondrial function. We also this is like the activity with other researchers from outside of UKM. We conducted a metabolomic workshop, okay, to share our experience on the platform. And we in 2018 and 2015, we managed to organize an international conference, which is International Conference on Antioxidant and Degenerative Diseases. So this maybe can also be done again in future. And of course, since we have got clinical trials, we also have an engagement with the community. So this is just example of our activity with Club Warga Emas in Klang Valley. So this is to show some of the research activities. Okay, here just to show that we have got our, in terms of the advanced instrument, okay, we in our study we are also using PET CT scan, okay, which is also available at the biochemistry department to measure the changes, okay, in the small animals by using the PET CT scan. And we also frequently use the DXA instrument available in Department of Pharmacology for the measurement of bone integrity as well as body composition and also muscle function. We also work together with UiTM Puncak Alam. Okay, so this for the muscle function study. So we are using their instruments. So we brought our animals to their lab to measure the parameters indicating muscle performance and muscle function. So again, more activities with the communities, okay, with the public, okay, because we are recruiting our subjects for the clinic for the 3 clinical trials that we are running now. So the 2 clinical trials are for the tocotrienol study, and 1 clinical trial is for the ginger study. So in terms of the strategies for enhancing aging and neurodegenerative disease research, this is the plan, of course. Start by to strengthen the multidisciplinary research ecosystem, and also to enhance or nurture research skills, especially in the young lecturers. So this can be done through brainstorming session. We also plan to have a proposal development workshop, okay, and maybe can also suggest the young researchers to go for a research training or lab attachment, workshops, as well as attending seminars and conferences so that we can increase, besides to enhance the research skills, this activity also can increase networking and research partnership, because the target is to work together with the industry, with the non-government organizations, as well as with the ministry, and also to collaborate internationally. And the aim is to get more research grants, either the national, these are the usual research outputs that we are supposed to produce, the publications, patents, the MOUs or MOAs with the industry or the NGOs, the awards, okay, maybe can also produce later what policy paper besides producing PhD and master's student. Not only to have this kind of outputs, but the impact shall be shown to the society and to community. So I think that's all in terms of the strength, the achievement of the research group. And if you want to join our research group, if you want to know more about the aging and degenerative research group, of course, can always contact me or contact the research group members as listed in the earlier slides. With that, I would like to thank you for your attention.
Okay, thank you, Prof. Susanna, for the precise presentation. So we move to next group presentation, Health, Technology and Innovation Group, led by Professor Dr. Zaliha Abdullah Mahdi. So, let's see from the recorded presentation. Prof. Zaliha graduated with a basic medical degree from UCAM in 1989. So between 1992 and 1998, she trained and obtained membership of the Royal College of Obstetricians and Gynecologists in London, master in OB/GYN, and doctorate in medicine from Newcastle University, United Kingdom. Okay, so shall we start with the recorded presentation?
Assalamualaikum and a good morning. HTIL at UKM, where healthcare meets technology. HTIL stands for Health Technology Innovation Lab. I would like to start off with telling you why the concept of HTIL is important. This is concept promoted by the government of Japan called Society 5.0. From a hunting and gathering society 1.0 to agricultural society 2.0 to industrial society 3.0 and information. Assalamualaikum and a good morning. HTIL at UKM, where healthcare meets technology. HTIL stands for Health Technology Innovation Lab. I would like to start off with telling you why the concept of HTIL is important. This is concept promoted by the government of Japan called Society 5.0. From a hunting and gathering society 1.0 to agricultural society 2.0 to industrial society 3.0 and information society 4.0, we are now advancing into society 5.0, which is a human-centered society that balances economic advancement with the resolution of social problems by a system that highly integrates cyberspace and physical space. So this is what Society 5.0 should be about, whether it's a social problem or a physical problem or a cognitive problem. You consider it being able to be solved by using the principles of Society 5.0. In other words, you use the progress in science in order to solve the problems in society. The current society is called Society 4.0, which is an information society. And as we move to Society 5.0, which is all about big data, artificial intelligence, and the interaction between cyberspace and physical space, we hope to be able to solve problems in terms of reduction of burden, optimal treatment, health promotion, and end up with comfortable living for all members of society. So this is where health technology innovation is important in order to bring about this change towards Society 5.0. So the sort of tagline of HTIL is a melting pot between healthcare and technology to give birth to innovation. This is the venue where we have first been given to operate. This was in the Nurses Hostel, level 3. But right now we have just moved to this newer location, well, not so new to the faculty, but new to us, at level 4 of the preclinical block, so much more comfortable. So you can come and visit us there. The idea of HTIL was first mooted in 2006, and the group moved initially in cyberspace. Several innovative medical items were developed, for example, the BRIM pelvic immobilizer, HIREPS, the hospital integrated resuscitation pendant system, HITMAN and IoT for vital signs monitoring, together with the Faculty of Engineering and Built Environment in Bangi. Recent developments that we have ventured into medical VR modules with installation of the Vitalis Active Move, the equipment or big screen that you can see in the picture just now, artificial intelligence in the pathology interpretation of slides. This is in collaboration with 𝐇𝐞𝐚, and big data in customized fetal growth charts in collaboration with the Parental Institute of the United Kingdom. And as I've mentioned, we've now secured a space, alhamdulillah, to operate as a physical location since last year. Now, commercialization is a very important aspect of health technology innovation, simply because we need that industry collaboration to speed up matters and to facilitate commercialization. Because without commercialization, your innovation will just sit on the shelf and nobody's going to make use of it. And it is also important for reinvestment for future research, to keep the research going on, where you go from version 1 to version 2 to version 3 of your product. So this is one of the success stories of HTIL, the Tricure pelvic immobilizer. And the products are not without any evidence to back it up, like this one. A cadaveric study was done to test its functionality, and this is what it is now, marketed by this company called Trinovate. And these are our vision, mission, and values in HTIL. Our vision is that HTIL should be a pioneer in translating ideas from the bench to the marketplace. This is what we aspire to be. Our mission is transforming ideas, fostering innovation, and commercializing healthcare technology. Our values, in order to move towards that, is innovation, creation, collaboration, commitment, and commercialization. You can abbreviate that to I4C or I4C. This is the scope of activities of HTIL. Virtual reality, drone technology, big data analytics, Internet of Medical Things, and artificial intelligence. The organizational structure is such: the deputy head at the moment is Associate Prof. Dr. 𝐶𝐞𝐚𝐥𝐿 Bing from FKAB, and we have quite a number of project leaders in various fields, particularly VR, mobile apps, smart isolator project, and the drone project, and another mobile apps is My Mums, which is under myself and Prof. Rosna Sultan from Public Health. So working across borders, as you can see, all those people who are listed here are from various departments as well as various faculties. So it is not only cross-departmental, but also cross-faculty. So that is the culture that we would like to inculcate in members of HTIL, to be able to work interprofessionally across boundaries. This is our drone in healthcare project. The objective of which is initially was to evaluate the feasibility of drone usage for transportation of blood samples and blood products in a tropical climate. And we have moved on from there to look into other more technical aspects of the drone as well. This is the timelines of our drone journey, starting from 2018. As 3 projects under one program, which received Dana Cabaran Perdana from UKM. And then in 2019, we actively collaborated with the Aerodyne Group. And subsequently, in 2020, Alhamdulillah, we managed to get another grant, which is much bigger than the Dana Cabaran Perdana from CREST, 660,000. And this is headed by Prof. Rosdiadi from FKAB now, but some of us are members in that group as well. And subsequently, we developed the blood ordering system, which is an app developed by Project 3. So these are the leaders of the 3 projects under the program. And these are some of our team activities: simulation flight in the Cyberjaya Aerodyne campus. Aerodyne was kind enough to let us use their flight area and their drone. And we had meetings even at the Aerodyne headquarters in Cyberjaya as well as in Cheras. And we visited their workshop. This is another project that we have, My Mums, in collaboration with Mersiniaga, the Malaysian Obstetric Monitoring System. You can look this up in the Mersiniaga website. It is published there. And these are the timelines of our work with Mersiniaga. We started off just as MCO started to kick in 2020. And by mid-2021, we started beta trial of the apps in HUKM, and subsequently, we collaborated also with USM as well as UIA. And currently, we are looking at starting beta trial in the 𝐾𝐞𝐚 Health Clinic or Klinik Kesihatan in Penang. This is what the dashboard of My Mums look like from the healthcare worker side. You can see a patient summary card, antenatal module items, postnatal module items, consolidated patient information, appointment widget, kit count widget, and there's even a doctor private notes if you need to jot down something that is confidential and that should not be seen by the patient, for example. You can put it down there. The good aspects of this is there is a list of health problems right on the dashboard in front here. So if the patient is GDM or 2 previous CAR or previous preeclampsia or active preeclampsia now, whatever, or group B streptococcus positive or HIV positive, whatever, you can write it all here. Okay, and whatever lab test results that has been done, not traced yet, you can also highlight at the front here so that the next person who sees this patient does not miss it. This is what the patient will see on her smartphone. Again, a patient summary card, summary of the medical history of the patient, the list of lab results that she knows the doctor will need to trace, and there is an appointment widget, and this will actually send out an alert to the patient 3 days before the date of the appointment. And there is also a kit count widget here for the patient to enter the fetal kit counts. And of course, here you have all the last menstrual period, EDD, there is an REDD that will override the EDD, okay, the parity of the patient. The color code according to the 𝐾𝐾M color coding. Now, you even have a venous thromboembolism risk scoring, okay, added here as well and automatically calculated once you have entered all the risk factors. Okay, so and if the patient is postnatal, what day postnatal is she? Okay, and there is a Q&A that the patient can enter down here in order to ask questions, ask the doctor any or healthcare provider any questions. And currently we have 200 plus patient users in UKM, 100 plus in USM, and about the same number in UIA hospital. And this is something that we would like to incorporate into my mom's. We are in the midst of working with the Perinatal Institute on this, the 𝐸𝐞𝐚 function. 𝐸𝐞𝐚 is a customized growth chart for the fetus, which is adjusted for the maternal ethnicity, maternal height, maternal weight, maternal parity, as well as maternal age. So every single pregnancy, not only every single mother, or every single pregnancy, meaning every baby will have his or her own customized growth chart. And once you've entered all the particulars that need to be entered, the parameters in the system will automatically generate the growth chart peculiar to that particular pregnancy. You will be able to see in a few seconds here. Okay. So voila, that's the growth chart that is specific for this particular pregnancy of the mother. Right, so other aspects that we deal with in HTIL, as I've mentioned just now, virtual reality. We have developed a few training modules, one in cataract surgery, foot and ankle surgery, one in disaster response, and two others are in progress, maxillofacial surgery and obstetrics and gynecology, particularly normal delivery. And we hope to be able to use these for teaching and learning. And there are therapeutic modules as well that we have developed or in the midst of developing in collaboration with psychologists and social scientists. One on autism social skills training, obsessive compulsive disorder, specifically the CBT module, cognitive and behavioral therapy module in virtual reality mode. And another one which is on the verge of being experimented at the moment is pain relief in labor. And apart from that, we can also customize virtual surgical planning based on clinical needs. So the products that we target are products which are for niche market and customizable. That's the beauty of being able to develop healthcare-related technology on our own, on local ground in our own country. You know, we are in touch with the people who developed it. Therefore, we are able to customize it according to our own needs. Okay, whether it's clinical needs or cultural needs, whatever. And it should be functional and hit the local or regional needs. It should be scientifically sound and evidence-based, and it should be authentic, designed with the help and input of experts in the field, in the specific field. And for the future, we hope there'll be a continuous cycle of research, commercialization, and reinvestment into research in a multidisciplinary manner with the industry, creating capacity building of future generation of researchers, whether it's researchers in the healthcare area or the technical area. And commercialization, as I've mentioned, is very important. Building subject matter expert, industry trust, and reliability as well as tolerance. So in summary, multidisciplinary collaboration across borders is the way forward towards achieving Society 5.0. Modern healthcare can only progress through working hand in hand with technopreneurs or industry players and experts from other fields, including engineers and social scientists. Commercialization is the channel through which innovations can benefit society in a sustainable manner, accompanied by progressive improvement and product enhancement. So these are some of the places where we have been featured in our own RESMI or Research Medicine Innovation Bulletin under the Faculty of Medicine. HTIL was featured there. Internationally, we've been featured in the Nest Garage by Leave a Nest, which is a researcher company. You can see there, HTIL. And we have also inked an MOU with Leave a Nest, which is a Japanese company, recently. And under Leave a Nest, there is this Tech Planter program, which aims to promote innovators in healthcare technology. So if you are a healthcare technology innovator, you can actually make use of this platform in order to get your product commercialized. It's under Leave a Nest. And where can you find us? In the Faculty of Medicine website under the Secretariat of Research and Innovation. Okay, you'll find this page, and under Population Health, you'll find this blue button, which is an active button. You can click on it and reach this page with all the details of who we are, what our objectives are, and how do you join us. Okay. And last but not least, before we end, I would like to play this short, corporate video of HTIL, if you like. Okay, developed by Dr. Hisham, one of our members. So here goes. Okay, so thank you very much for your attention, and we most welcome you to join HTIL if you have common interest with us.
Okay, thank you, Prof. Zaliha, for this presentation. So we will have a very short commercial break, and then we resume back at 10:15. Okay, we resume our symposium with the next presentation by the 𝐸𝐞𝐚 group. The 𝐸𝐞𝐚 group is led by Professor Dr. Raja Effendi Raja Ali. Professor Raja Effendi Raja Ali graduated with honors degree in medicine and completed higher diploma in clinical teaching, Master of Medical Science and Doctorate of Medicine from the National University of Ireland. He underwent higher training in gastroenterology and hepatology and was awarded the Certificate of Completion of Specialist Training by the Royal College of Physicians of Ireland. He is a Fellow of Royal College of Physicians of Edinburgh and American Gastroenterological Association. Please welcome Professor Raja Effendi.
Can you see the screen, Dr. Haikal?
Yes, Prof.
Okay, salam sejahtera and a very good morning. I suppose we are group number X to present. Gut Research Group, I represent not myself, many are outstanding researchers as you can see on the screen. So our group is a gut research group from the mouth to anus basically, or digestive system, including liver and hepatobiliary and also pancreas, all the things. Now, a little bit history about our group. Back in end of 2015 or so, I got my buddies have lunch and discuss a bit what we're going to do for the next couple of years in terms of getting the grant, getting the students. So we gather together, we do some collaboration fragmentally in the Department of Basic Science, Physiology and Biochemistry, but was not formalized until we formally formed a group in 2018 with a mixtures of basic science, clinical, physiology, medical, microbiology, immunology, pharmacology, pathology, and surgeons and dietetics and other disciplines also. So formally, we established a group end of 2018, but we also in the process and also doing extension outside the UKM. We are lucky to have a great two outstanding researchers, Professor Lee Yong-Ye from the USM, the top research scientist by Academy of Medicine, gastroenterologist, and also Prof. Ahmad Al-Umar, the distinguished international professor to the faculty at that time. So we also appoint him as our collaborators and basically mentoring our group too. So we also planning associate members outside UKM. We have rising stars. I have described Dr. Hajar Fauzan Ahmad, got PhD in Denmark, do a lot of sequencing, and now working at UMP. He's doing a lot of sequencing in plant biologists, but also now he's translated into the human that we asked him to do plenty of NGS sequencing, 16S sequencing, and many other, not only bacteria, but also viral and fungal, which is really useful for us. And Dr. Dalina from Faculty of Pharmacy, Imperial College, who do work on the pharmacotherapeutic in the inflammatory bowel disease. And we would like to get more from industry and NGOs in the future getting the few candidates for interviews. So, a gut-related group. No, should I mean, there are studies. I'm not going to show the list of whatever that we're doing of note. The most recent one that been doing by our clinical masters, medicine, Dr. Izrina, finishing her work already, funded by the industries, and we also will get RAs from the industries. Sometimes we don't have a candidate for the RAs and end up most of the work done by the clinical master student. Fair enough. And she's very good. She's been doing the oral Young Investigator Award this weekend, and also in the Asia Pacific International Digestive Disease Federation in Hong Kong, September. So we are very particular in choosing the right phenotypes of the student, so that we want to ensure the progression of your part, and quite important for the group as well. We also explore about fatty liver. This is mostly Dr. 𝐸𝐞𝐚𝐥𝐿 Najmi, our consultant in gastroenterology and pathology. Again, we work closely with the industry. He's doing some works on look at the intestinal permeability in the fatty liver, and we have, in this case, is unique, and that's what we are planning to do in the future, where we combine a clinical masters and also a student who do master by research in master medical science. So someone do on the clinical aspect, the other one doing on the animal model aspect, so or a lot of basic advanced science molecular biology aspect. So we get two results simultaneously, which is, I think, the way forward that we should do, rather than focus on mostly clinical. We need to focus on the translational. And these are the work that I've been doing for the last year or two by Dr. Najmi, and I think doing very, very well at the moment. And I'm sure there will be more paper to come, and early papers also being published by him. And he also got award at the Asia Pacific levels of his work, and it's clearly to show the I think the importance of having quite a nice group. Another issue another arena that we adventures in our group is Helicobacter pylori, rarely championed by Associate Professor Dr. Alfiza in microbiology and immunology department. I think she got tremendous work in the Helicobacter pylori, and I've no hesitate to say that in Malaysia, perhaps she's the one who really adventures in Helicobacter pylori. She also has a lab to do a culture sensitivity, and this is really give, she's really enterprising already, really give income to the department and to the faculty and university, where many private physicians who send the samples, but this may need to be in the more coordinated way to get more revenue in the future. I think she has done a tremendous work. I'm not going to go through one by one, a lot of outputs, and a grant either in-house or nationally, and of course output is a huge to the students and to the group, and also books that have been published by her good self. So I think this is really good in terms of showcase our strength in the arena of Helicobacter pylori for those who are interested in this thing. Now we also engage Mayo Clinic. A lot of clinicians might know, and they're really interested to know our work in the two aspects, Helicobacter pylori and also inflammatory bowel disease. So we got an online symposium with all these gurus from the Mayo Clinic laboratories, and also based in Singapore. So we are doing something behind the scene at the moment to explore further in terms of sending the fellows in the future in the Mayo Clinic, sending the scientists in the future, Mayo Clinic, to do some lab and the clinical work in the future. Now, we also have some with Sime Darby in terms of focusing for tocotrienol refaction. I know the other group also doing this. And again, Dr. Najmi and Dr. Fiza also doing this on the molecular aspect, how to evaluate some local market to tackle the fatty liver, which has no definite remedy at the moment. And Associate Professor Dr. Jaya Kumar, the neuroscientist, and also contributed significantly to our group in terms of many basic science. In this case, that you can see on the slide there, And of course, I think many researchers may have more than one group in performing the research. So I think it's a great value added to our group that neuroscientist for Associate Professor Dr. Kumar. Again, he also championed the industrial grant and that we stay ongoing at the moment and doing very well about exploring all this antidepressive effect in a rat model and also simultaneous in the human model of the patient with irritable bowel syndrome. So I think that's the plan that we want to do. And thank God we actually, despite about 4.5 years or so, we got Anugerah Bitara from the UKM. And so to summarize a little bit, our research practice, number one, the most important is collaboration. Not only intra or inside the faculty, but also inter-faculties, inter-specialities or inter-universities. International networking and to get support from the industry is very important so that we not disturb the monies in the faculty in terms of not only grant and in-kind, but also supporting the publication. And we would like to have a targeted grant every now and then, either nationally or internationally. We have explored. Again, of course, at the international level, a lot of rejection, but we will keep trying to get a handsome amount of international grant for the future and explore further with regard to digestive disorders. And we're also diversifying the group and we're starting entrepreneurship soon. I think at this era, we need to have the enterprising in whatever aspect they're doing, not only clinician scientists, but also we get a couple of engineers, businessmen, or funders into our group. And we have a branding. So now our articles for the last 3 years, we have an affiliation, a gut research group. And I think that great strategies because following the high impact publication, we got a response from the industry and from other stakeholders who would like to collaborate with us with the existing research group and still not very well established. But I think group branding is very, very important. And working with industry is quite important for us, not only for the funding, but also from the bench to the market, or from the bench to what we can do with them in terms of commercialization, and not only in terms of products, but we also focus on the services, consultancy in the future that we're starting a little bit at the project at the moment, and many more practice that we're going to go to international level. We're going to go to many other research leadership courses. We're going to sponsor a student who join us and also the lecturers. And of course, this is funded by the industries. So the area of research, what we're doing is, I mean, I'm not going to go very detailed, but in the area of digestive disorders, either you like to do a basic or advanced sciences, clinical and translational researchers, and also involve many disciplines, and more importantly, to get a value added in the distinguished centers with the international collaboration. So if I would like to summarize to all of you who participate in this program, what's in it for you actually? So what do you get from us actually? We would like to get a combination of clinical work and science. We would like to get people who do a master's to potentially to upgrade to PhDs and potentially get clinical attachment or fellowship abroad in whatever your specialties. We would like you to get the postdoc in overseas. At the moment, our student finished PhD last year, now doing postdoc in US, in Carolina, through our network. We have dedicated research progress meeting. This is very important to monitor. We can talk whatever you want, but monitoring the students, and I have to salute Prof. Nafiza here with the students that religiously doing dedicated progress meeting very well. And we also would like the student to possibly unlock your research leadership. You know, you can work in silo, but if you're bringing more leaders, research leaders in the future, so the group will be expanding not only nationally, but also regionally and internationally. So we are planning some course of research leadership, hopefully in the NUS for our lecturers and our students, sponsored by the industry. And of course, potential to work with industry in the future. So we have Chris left us and worked very well with in Nestle in Singapore. doing work with industry, and he's doing very well. And we get in touch with him at the moment. And potential to get sponsorship from industry is a massive. So we always get all the students to attend the meeting, completely sponsored by the industry, provided the students must have the abstract to go with, not just themselves. And of course, we in the process of hopefully by first quarter or second quarter next year, we're going to get a dedicated annual funding from various industry. We're aiming around maybe 200 to 500K per year with a good return on values and also return on investment to the industry. Now, if I would like to express a little bit the present and perhaps the future of GUT Research Group in terms of doing a business, a model canvas to us and to all of you, where the customer segments, so a lot of students who are coming to us. And not only that, we also get the query from insurance company, from the clinics, other hospital, from industry to be part of our customer segment. And of course, we have to maintain the customer relationship, doing all of these many things and key activities, as I mentioned to you, predominantly digestive disorders, and in the future, innovations, and all this to attract the industries and discovery research. And we got a value propositions for mostly related to the GI disorders. And the key partners, we have identified a few investors who are interested as a matter of getting the pitching date to them, and also public and private universities, and also a trust that we also secure some grant, Hamlet Trust by the IBD Studies Multi-Center. So we're going to get a dedicated RA for that. And in the future, hopefully, we have our own cost structures that we have at the moment. We're going to get some revenue streams, so whatever we're going to do, some research and teaching, learning, and consultancy for some industry that actually made inquiry with us already. And of course, at the moment, our key resources still limited. We are no dedicated building or dedicated office, but I think in the future, we might have this with the attractiveness shown by a lot of other stakeholders that contacting us. So I think that is our group, and these are the contact if you are interested in exploring digestive disorders. And I have to thank Dr. Najmi to prepare some videos for us. So this is about a minute or so for you to watch. Thank you so much. Thank you so much. I pass back to Dr. Haikal. Thank you for your attention.
Okay, thank you, Prof. Raja Fendi. So we move to the next research group, molecular insight to primary electronism group, okay, led by Associate Professor Dr. Elina Aisha Azizan. So we like to invite Associate Professor Dr. Elina. So can I have the short biography? Okay, Associate Professor Dr. Elina Aisha Azizan completed PhD from University of Cambridge in early 2020. Trained from the body and joined the Department of Medicine in charge of identifying clinical examination laboratory. Study in primary electronism in Malaysia and Malaysia and also locally. Particular definition in 𝐶𝐶 Award and in Dominion in Communication Federation of Enterprise Society and the Young Investigator Award for the Education Enterprise and Communication Conference. So please welcome my Aisha for her presentation.
Sorry.
Yes, your voice. Yeah.
Can you guys hear me?
Yeah. Can you?
Okay.
Yeah.
Can you see my screen?
Yes. Yes.
Okay. So it was just my luck to go after very established groups and by very amazing leaders, Prof. Effendi and Prof. Zaliha, but I tried to make the best for my group, which is the molecular insights to primary aldosteronism. So,
Dr. Elina, can you please speak louder because I can hear your voice.
oh, okay. I think this is the loudest I can be. Maybe I just talk louder. Is that fine?
Yes. It's fine.
Okay. All right. So yeah, so myself as the project leader, and then the other faculties members that are involved with this group is Prof. Nadira, Prof. Shikin, as the clinical endocrinologist, and then we have Prof. Rohaiza and Associate Prof. Dr. Nani as the surgeons, and Prof. Rosman to give the radiologist input. And then for national collaborators, we have Associate Prof. Dr. Azian and Prof. Rahman from UMBI, and Dr. Azrai, endocrine specialist in Hospital Putrajaya, and Prof. Nur Azmi Kamaruddin, who was previously here, now in IJN. And we have many international collaborators, Dr. Mankit and Prof. Bernard from University of Manchester, Prof. Maurice Brown from Queen Mary University London, and Prof. Michael Stawisser from Australia, Associate Prof. Miroslav from Czech Republic. So quite a good international collaboration going on with this group. So unlike the other groups, I'm just going to go a little bit into the research topic as to why you might be interested in joining the group for molecular insights to primary aldosteronism. So a bit on the research background. So 1 in 3 adults in Malaysia suffer from hypertension, and hypertension, most of you know, is from high blood pressure. Is a silent killer. This means that those who don't have proper treatment of their high blood pressure has an increased risk for not only heart disease but stroke. So a lot of comorbidities you can get if this hypertension is not controlled. And blood pressure is regulated by the renin-angiotensin-aldosterone system. So the hint is in the word aldosterone. So primary hyperaldosteronism, which this group is interested in, can cause hypertension, but it is vastly underdiagnosed. So this is where we come in, or this group comes in. So we're interested in primary aldosteronism. So primary aldosteronism can be caused by aldosterone-producing adenomas or aldosterone-producing cell clusters. And why we're interested in the molecular insights is because these APAs and APCCs harbor somatic mutations in aldosterone driver genes. So these following genes that we had found: 𝐘𝐶NJ5, ATP1A1, ATP2B3. So these are ATPase pumps, 𝐸𝐞𝐻1D, and CTNNB1. So some potassium channels, calcium channels, and related with beta-catenin. But what we found is that these APAs that have different genotype actually have different, not only cell morphology, but also clinical phenotypes such as gender bias and tumor size. So large 𝐾CNG5 APAs have the F-like cell morphology and secrete 18-hydroxycortisol, whereas small 𝐸𝐞𝐻1 APAs of different morphology, the zona glomerulosa, which is actually the physiological zone that secretes aldosterone. And this is more common in the very small aldosterone-producing cell clusters at older patients. So we are interested in trying to identify why they have this different morphology when they have the different genotypes, and what we do know or is accepted, but we don't really know, is that the cells in the adrenal zones, it starts in the capsule from stem cells in the capsule, which leads into progenitor cells, and then leads to the differentiated cells, which are the different zones, the zona glomerulosa, the zona fasciculata, and zona reticularis. So we want to not make this a dogma anymore, but we want to make it for certain and understand why does certain cells acquire these certain different mutations. Why is that? So we are lucky because aldosterone producing adenomas, so from our surgeons, Associate Prof. Nani and Prof. Rahaiza, we get these aldosterone producing adenomas because they actually can be cured of the hypertension, the patients that have an aldosterone producing adenomas when they have this.
Excuse me, Dr. Lina, can hear you. I can't hear your voice.
Now?
Now it's okay.
Yeah. Okay. So whereas normally for bilateral adrenal hyperplasia, you do not have the treatment, you have mineralocorticoid receptor antagonist. This is a rare case where the bilateral adrenal hyperplasia, one side or maybe both sides, are taken out. And why would you want to take it out? Why not just control it with hypertensive medication, so meaning symptomatic treatment? Well, because primary aldosteronism, if you see in this bar chart on the right hand of the two pairs, always have a higher odds ratio of stroke, non-fatal myocardial infarction, and atrial fibrillations, even when you match it with essential hypertension. So it has a more higher comorbidity than just those with hypertension. So this is where my group comes into play, which is, does the heterogeneity among the APAs have a genetic basis? We had previously found that with the 𝐾CNJ5 at least, that there is a big range in the molecular profile of APAs, and there was actually a 800-fold difference in CYP17A1. Now, CYP17A1 is for a gene encoding for the steroid enzyme 17-alpha hydroxylase, which should only be in the zona fasciculata. So not in the zona glomerulosa, where it physiologically produces aldosterone. And the histology showed that there is 0% of the F-like cells in one versus 100% in another. So there's a vast spectrum of not only the histotype, but also the molecular profile. And when we panned it out with the diameter size and age at surgery, you can see that there is a sort of like a boxing ring. You have the red big circles here and the blue square circles here, where the squares are actually male and the circles are female. So they seem to segregate. And then when you look at the mutant versus wild type in the percentage of compact cells, there seems to be mutant segregates here, whereas the wild type seems to be split up into two groups. So in Malaysia, so that was back in UK where I did my PhD. So in UK, in Malaysia, I wanted to continue. So with the help of pathologists, Prof. Tan, Prof. Issa, and also the science officer Maya, managed to look at the histopathology and genotype of the APAs, and actually found the new 𝐸𝐞𝐚𝐥1D mutation here, which was then functionally characterized by people in 𝐸𝐾-STRIKE group, and they found that this 𝐸𝐾𝐚𝐥1D mutation did shift the voltage dependence. So it was a functional mutation. And similar to what we had found or in 𝐾𝐶NJ5, they do seem to have a specific histopathological phenotype, although surprisingly, these larger 𝐾𝐶NJ5 mutant APAs actually had a lower proliferation rate. So even though they're larger in size, they had a lower proliferation rate. So we thought, what can this help? This is all much basic science. How can this help clinically? Well, actually, it can help clinically because you can have distinct genotype, phenotype, which could facilitate diagnosis. And this is an example of how it can. So for example, in this one, we found that CTNNB1 mutations stimulated the Wnt activation and cause adrenocortical cells to de-differentiate toward the common adrenogonadal precursor cell types, which means that now it can be activated by hormones that was highly present normally when you're pregnant, and therefore you get a more aggressive phenotype when these ladies are pregnant, and you can then the output of the clinical is that you have to take note during the first trimester if the patient have high blood pressure, which normally in a normal pregnancy would be in the second or third trimester. You should question whether this could be caused by this sort of adrenal CTNNB1 mutant APAs. But at the time when we published in, even though it's a high impact journal, there was questions because this other groups had said there were no association with pregnancy in any other cases. Why are our group only finding? And they were not persuaded that this link was an activated mutation in beta-catenin, and whether the association with the hormone receptors actually underlies a prevalent cause of primary aldosteronism. And they were questioning, why do these CTNN mutant APAs in other cohorts were not found to have the high gonadal receptor, which is LHCGR, or had the clinical presentation of onset at pregnancy or menopause. So even if you publish in high impact journal, you do still get questions and criticism targeted at your journal. So we had this question. So actually, we did not find the whole answer when we had published in NEJM, but now we do have the answer why did they not find what we found. So actually, in our 3 patients that we had submitted, they are among these patients here. It is 10 patients here, and they, on top of having a CTNNB1 mutation, had a GNA11 or GNAQ mutation, which then meant that the aldosterone-producing adenomas can present in puberty, pregnancy, or menopause. So you can see here we've added one more patient, which actually helped us to identify this double mutation phenotype, which is actually this patient who was a 12-year-old boy. So all the others were female, pregnant, and presenting at menopause. This 12-year-old boy who hit puberty, had large testicles, and he had that phenotype, and he actually had these 2 mutations. So when we looked from the basic science, we can see that there is additive effects of GNA11 and GNAQ on the CTNNB1 mutation. So we weren't publishing rubbish, so to speak, but what we found was that you actually had an additive effect from having the GNA11, and this explains why others did not find in the cohort, and we actually had included other cohorts in this paper from France, from Germany. So we know now that it is the answer. So enough about the research background. I'd just like to talk a bit about the students in the group. So we have Fatin Atira, who's an ongoing PhD student. So she is interested in the aldosterone producing cell clusters, so the APCCs I was mentioning, and how it can actually increase with age. So it could be that aldosterone producing cell clusters is not only related to primary aldosteronism, but also present in those who don't have a clinical primary aldosteronism phenotype. Okay. And then we have PhD student Siti Khadijah, who's interested in somatic mutations in the aldosterone producing adenomas, and to find a biomarker for this to be able to cure this disease. We have Dr. Loh Hua Heng. This is actually under Prof. Nolela, who is interested in looking at primary aldosteronism in diabetes, bone health, and sleep apnea. We have Afifa, who's actually awaiting convocation, who looked into genome-wide association studies. We have Shahira, who actually managed to win herself the this was the Young Investigator Fellowship Award in the APCH. So I am very pro sending my students to go out, and she managed to publish in a high impact factor. We have Dr. Muhammad Arif also, who graduated, who looked at Malaysian patients and how many of them had high aldosterone renin ratio. We also have some MMed students who had graduated looking at vitamin D, and MMed Sci students like Gani, who has also graduated looking at the aldosterone renin ratio in Peninsula. And I have a few international grants which had allowed Kachin, who's a part-time student, also science officer here in the endocrine lab, to manage to do flow cytometry techniques in UK in Queen Mary University London for 1 or 2 months. And similarly, Nur Fatin Shazrin, I had another international grant which allowed her to learn CRISPR technology at University of Manchester. So our research goal as a group is actually looking at what is the precursors for this APA and APCCs, finding the stem cell, the progenitor cell, the hypermutable cell, and to answer why only some genes, so those 5, 6 genes, and actually in the adrenal is the top 5 organs to have the most somatic mutations. Why is it the adrenal always have mutations, you know? And to find a targeted treatment of aldosterone related hypertension, because we are using 10% of kkm to treat hypertension, we need to do targeted treatment to have efficient usage of resources to prevent this high silent killer, high burden silent killer. And we need to do something about our underdiagnosis, because we only have less than 1% of diagnosis. So we need faster and better screening and diagnosis of hypertension. And we believe this is through characterization of biomarkers for the precursor cells of APA and APCCs. So just to put this all into perspective, there is a distinct cell morphology and clinical phenotypes of the different mutant APAs, and this suggests that there are different cell of origin. So here's the adrenal cortex with the different zones, and the dogma, so not the truth, but the dogma of adrenal cortex development is that it's an unidentified stem cell in the capsule. It migrates, and then it proliferates, and it transforms into the different zones. But we want to show how this happens, how is it done. And we hypothesize why there is so many somatic mutations in the adrenal is because there is maladaptation to our modern diet. So our modern diet, we like nasi lemak, KFC, all chronic high salt intake, and this modulates aldosterone production in ZG. And when it goes haywire, that's when you acquire the somatic mutations and inhibit centripetal migration. So just to really stress, the adrenal gland is among the top 5 organs in humans. This was recently published in Science 2019, and it's significantly enriched with non-synonymous mutations. So mutations that cause an effect on the protein. So moving forward, we would like to identify and characterize these cells in the human adrenal cortex and find the hypermutable precursor cells for the different mutant APAs and elucidate why this somatic mutation occurs. So if you have any interest in aldosterone or interest in adrenals or even interest in hypertension or primary aldosteronism, do come and join and drop me a line. Okay, thank you very much. If anyone has any questions, thank you.
Okay, thank you, Associate Professor Dr. Edina Aisyah, for the precise presentation. Okay, see, we move to the next group, research group, the bone metabolism group, led by the Associate Professor Dr. Nuriza Muhammad. So, Dr. Nuriza Muhammad is the Associate Professor in the Department of Pharmacology in Faculty of Medicine, UKM. She qualified in medicine from University College Dublin in Ireland, 1997, and completed a PhD in pharmacology in UKM 2007. She began researching the effect of tocotrienols on bone health for her PhD and spending her research focus on effect of natural product on bone metabolism, particularly on post-menopausal osteoporosis model. So without further delay, we would like to invite Associate Professor Dr. Nuriza Muhammad for her presentation.
Thank you very much, Dr. Haikal. Let me share with you my screen. Yeah. Sorry. Sorry, technical issue. I didn't realize this is actually video. I'm so sorry. I think I'll just do what do you call it? This slide view. Okay, is that okay, Dr. Haikal?
Yes, okay.
Is it okay? Yeah. I'm sorry. I actually edited this slide on the video format. I'm so sorry about that. Yeah. So I'm going to introduce to you bone metabolism research group. Okay. So this research
group. You put on
group.
slideshow?
Sorry.
Can you
no,
put on
the slideshow is actually on video mode.
I see. Okay.
I didn't realize that. I edited on the wrong format. Okay. So is this okay? Yeah,
sure.
Yeah, okay. So this bone metabolism research group was set up in the year 2007. The founding leader was Prof. Dr. Iman Irwana Sulaiman. Okay, so we established this group because we wanted to study on all aspects of bone metabolism, especially on osteoporosis as well as osteoporotic fractures. So we do both preclinical and clinical studies. Mostly our group involves preclinical studies, although we have also ventured into clinical studies quite recently. So our group members, this is quite a big group. Okay, this is myself, and this is our founding leader, Prof. Dr. Iman Irwana Sulaiman. Prof. Dr. Farida is from the forensic department. Prof. Norazlina is from the pharmacology department. Prof. Dr. Sabaro from the orthopedic department. We also have Associate Prof. Dr. Isa Naina in pharmacology department. Dr. Sokwan, Wang Sokwan, Prof. 𝐸𝐞𝐿𝐤, they are both from the pharmacology department. Associate Prof. Dr. Elvi and Dr. Kairos are from anatomy department, and we also have another clinician in the group, Prof. Dr. Saktis from the medical department. Okay, so we have a mixture of both clinical and preclinical lecturers. So basically, as I mentioned earlier, the bulk of our study, the bulk of our research focuses on the osteoporosis studies. We wanted to discover and develop new therapeutic agents for osteoporosis. So we do both in vitro and in vivo research, the in vitro involving bone cells, individual bone cells, as well as co-cultures using ex vivo scaffolds. Okay. So in the in vivo models, we use different animal models, mice, rats. We induce them differently. For example, if the model is also the postmenopausal osteoporosis, we overactimize the rats, and we remove the gonads. So that is, estrogen deficient osteoporosis. And we also have another model, nicotine-induced model, for assessing the effects of nicotine or smoking on bone metabolism and bone loss. Okay, and we also have we also induce rats to become to make them having metabolic syndrome. Okay, so we overactimize the rats. We give them high-fat diet to make them develop osteoporosis, obesity, as well as cardiovascular disorder. Right. So these are among the research, the in vivo models involved in the group. Okay. Some of the group members also venture into joint health studies, and this that's why we have a rheumatologist in the group. So basically, we also are interested in developing new therapy for diseases like arthritis. Okay, so at the moment, we use, because we want to develop new agents, right? So we use natural resources, okay, mostly tocotrienol, as well as other forms of vitamin E, okay, from the from palm, also other sources of vitamin E, or other sources of tocotrienol, such as annatto. Okay, so we also use other agents like other herbal compounds or herbal materials, plant materials such as virgin coconut oil, Cosmos caudatus. Cosmos caudatus is ulam raja. Piper sarmentosum, it is down cadoc. Picus deltoidea, this is mastrotic. Okay, so this is just among the few examples that we have in our research. Okay, we recently introduced, or we recently managed to get more agents in order to study the effects of different active compounds in plants, okay, on bone metabolism, on osteoporosis. Okay, so I'll just give you some examples. Yeah. Of other. All right. Okay. Sorry, that one is the lab research, the lab work. We also do clinical studies, mostly involving bone and osteoporosis studies. So, for example, in this case, this project is led by Prof. Dr. Nurazina. We did an epidemiological study, okay, to screen and to introduce education program on bone and metabolic health, okay, and among the elderly population in Klang Valley. So we measure all the bone. We assess their health status. We get their bloods to get tumor markers, the cardiovascular status. We also assess their bone, their BMD, okay, using DEXA. We have our own DEXA for research purpose in the Department of Pharmacology in the preclinical building. Okay. Another ongoing project is the pharmacoepidemiological project. Okay, this is a study done by my PhD student, who is a lecturer in UNIZA in Terengganu. So she is comparing the osteoporosis management, yeah, following osteoporosis fractures between between HCTM and the tertiary hospitals in the East Coast, the hospital in Terengganu, Kuantan, and Kota Baru, HUSM. So this is in collaboration with the orthopedic department on the 3 hospitals. Okay, and mainly we involve clinicians, the orthopedic surgeons, yeah, such as Prof. Dr. Sabaro, in order to in order to study this what you call it, the osteoporosis management, and the difference in because they have different management, and our hospital is what you call it, accredited in the fracture liaison service, right? Okay, so besides study on the animals, on the human, we also did study on the prehistoric bones. Okay, this is a very interesting study where Prof. Dr. Ima is in collaboration with the people from the museums and the archaeological department in the UKM Bani. So they found some prehistoric bones, and we do bone assessment on these bones. Okay. So this study is still, I think it's towards completion already, and they have published some of the findings. Okay, so our collaborators, we have collaborators from Shanghai Jiaotong University in China, and we also are in close contact with Dr. Barry Tan. He is the CEO of American River Nutrition. He mostly supplied anatotocotrienol for our research, as well as he gives us trainings and the guidance on the industrial aspect of pharmaceutical activities. Okay. I'm sorry about my slides. Okay, so these companies, these are just examples of companies that we collaborate with. They mostly supply us products, okay, for our bone research, such as Phytogaia, Excelvite provide us vitamin E, palm vitamin E. Accent Wellness provide us with trainings, as well as they support us in financially in our research. And Devos also supply us keratin, as well as vitamin E. Okay, so this is just to showcase I think I'll just go this quickly, some achievements in the bone metabolism group. We win the research category for the faculty. Okay, some Prof. Ima, Prof. Gabriel, and Dr. Wan Sokwan won Anugerah Buku Negara recently. I'll just go this quickly, some of the achievements. Okay, so yeah, medals that we received on the International Research Expos. Our patents, okay, we have patents related to bone, okay, such as a composition of palm vitamin E as a bone strengthening agent to prevent fracture and promote fracture healing. And we also have a patent in a bone scaffold, all right? Okay, so some publications by the group. I'll just go quickly. All right, some appearance in the mass media. This is a study by Dr. Issa Nirwana on the effect of sports, yeah, in adolescents. Okay, Prof. Dr. Ima on palm vitamin E and tocotrienol. Prof. Dr. Harida on the forensic aspect. Okay, this is our one of the article on bone health. Okay, and yeah, so if you're interested to join our research, you can contact me and contact the department. Okay, that's it. Okay, Dr. Haikam?
Yes.
Yeah.
Okay, thank you very much, Professor Dr. Nurliza Muhammad, for the presentation. So we can move to The next group by the population health group, led by Associate Professor Dr. Rosna Sultan. Okay, so can you please okay, the biography. She is known for her expertise in the area of health seeking behavior, social determinants, and participatory action research related to population health. As a public health physician with 10 years experience working in the Ministry of Health at various levels, from the health clinic, hospital, managerial level for program-based planning, monitoring, and evaluation in family health. Scope services, in particular, the maternal and parental health. So without further delay, I would like to invite Associate Professor Dr. Rosna Sultan for her presentation. Group 7. Thank you.
Thank you, Prof. Michael. Allow me to share my slide. Okay, can you all see my slide already, isn't it? Okay, let me start. What's this? Okay, Assalamualaikum, good morning and salam keluarga Malaysia to all participants of the 24th Medical and Health Research Week. I'm here today to captive your all interest in conducting population health research. So, in UKM, we have UKM research clusters, and there are 5 big research clusters served by researchers of UKM. Today, we have looking at one of the research clusters, which is Advanced Medical Health Research clusters checked by Professor Dr. Nurfiza Mokhtar. So this is the one of the 5 clusters, and this is the 7th focus group. And I'm under the public health focus group. So we talk about population health. So we have heard earlier showcase presentation, and now it's time for me to showcase some of it. So the scope of research is based on major public health issues, but does not overlap with other research groups on fundamental niche, like diabetic, degenerative disease, our research group, non-communicable disease, infectious, etc. So I am the head of the population health research group, and I involved in population health research for more than 20 years, and I have more than 50 students completed their research and show their output to be utilized for creating new concepts in fundamental research or solving problems in applied research. With the research knowledge, they become an experts nowadays in their field scope. So, yeah. So for as an outline of presentation, so these are the outline. So introduction to the population research group, scope of the population health research priority, showcase examples from members of the group, and the future direction. So as the population research group, population health research group address determinants of health research, and equity in promoting well-being. So as we know that population health research group, normally we deal with big data. So we need to know how to linkage all the data and try to explore the determinants to the outcomes through various research methodology approach. If you know that in population health research, we have many experts who are very good in the methodology and statistical component. So the goal of the public health research is to prevent disease, as what that you all know. Yeah. But actually, we are not only preventing the disease, but we also looking in terms what factor, what component that can influence the population health. So such as like healthy lifestyle patterns. So scope of population health research covers, this is the 9th scope: social determinants of health research, quality of life research, behavioral science diversity, which is involved in the minority group, refugees, health equity research, health service research in terms related to the system, healthcare delivery, and the methodology tools that we are going to use. And then healthcare economic and case mix, health measures in terms of looking for the performance in a
performance assessment, health innovation in education, health monitoring and evaluation. So all of these, actually, there is some priorities that under Rancangan Malaysia ke-12 as well as the SDGs and whatever the KKM priorities. So normally what that we do, we need to follow what the country requirement. So these are the 6 components that are being a priority. So preventing diseases through determinants of health, improving primary health care and medical care, promoting health and enhancing behavior and health policies, environmental health, occupational health, and the last one is health economy. So this is the list of our population health research group members. The majority are from the community health department. Yeah, so we have a list of community health department staff, but we do not have. But we also have some other department, such as like for medical, it's led by our dean, our postgrad deans, and others. And then from family medicines, yeah, from secretaries, from nursing, from I also, and then from emergency department. And for other faculty besides medical, also some also involved. Like these two are from allied health science. Yeah. Some people like to do population research but may face challenges, yeah, on how to conduct and complete their research. Our team is very keen to help, and so please contact us. Not only contact me alone. Yeah. Today we will show you a few of the research on the population health from our research project as a showcase. So dreams need the effort to make it happen. Yeah. So forming the population health research group in a top-down direction leads to big challenges that we need to face. Before we have this research ideas cluster, every one of us had already started our research work in various ways, but not in a specific team like population health research group. The population health research group is newly formed and academicians voluntarily enrolled into this group. As usual, financial and manpower support is always a matter as a start, and not to mention infrastructure and facilities. As our team comes from different research exposure background, we need to refine our scope of research, listing of our strengths, tools, and goals for future direction, not like what that you have learned before from other groups. They are very structured because they already start early. So now I need to showcase in 20 minutes. That is another challenge for me because we have very big and very diverse scope of research. In the next slides, I'm going to showcase only 5 members of the team to help you understand research in population health in a better way. I hope you all can see the way the research was conducted and how it can give an impact on the society and the healthcare system, because our subject is on population health. So the next slides. Yeah. So I start one by one. Yeah. So I think everybody knows him. Yeah. So let me introduce our first member of as a showcase, Prof. Dr. Muhammad Rizal. His main areas of research are cost effectiveness analysis and quality of life. Being a researcher as well as academician, we dream of success in grooming our students for excellent thesis and good impact on society and healthcare. A recent completed research project under Prof. Rizal, he managed to have a student graduate on time with an excellent thesis. Yeah, so this is the certificate. His research output on the projection of the economic burden on end-stage renal disease to the public sector in Malaysia has been taken up as an evidence to the development of the renal transplantation program. So this paper, as a policy paper, being presented to Minister to come up with the renal transplantation program. So next is Prof. Dr. Anisa. Her main interests are public health, health management, quality of care, and health economics. Recently, she has a doctoral student who graduated on time and managed to come up with a good numbers of high impact factor journals. And also his student output is being used to revise the program to better serve society and healthcare plan as the Family Doctor Shared Program. So now we go to our strength. Yeah? In the Population Health Research Group, the case mix is another strength. We have in HCTM. Prof. Dr. Azimatul Noor is the head of the International Case Mix and Clinical Coding Center. Many ongoing type of research are supervised by Prof. Dr. Azimatul, and you may have some interest to explore more of her research project, so please contact her. Yeah. So now, conducting research vigilantly will drive us to become an expert in the field. In environmental health scope, Prof. Dr. Muhammad Hasni is well known locally and internationally for his expertise in toxicology. Through several types of research and consultation, you will become an irreverent person for others like him. So please contact him if you have you want some tips from him. Okay, next is about collaboration. The ability to collaborate for financial research and manpower support is highly demanding in view of conducting big data collection. Prof. Dr. Rosita Hood has several collaboration MOA with industries, and she has managed to publish the highest number of Q1 journal for this year, 8 papers, under our Faculty of Medical Science. So, next one is, so I think everybody knows him, or maybe some of you know him because he taught you all in first degree. So occupational health is another scope of population health, and Prof. Dr. Noor Hashim is an occupational health expert who have many research collaborations with industries. He has been awarded as 2% scientist by Elsevier through his collaboration with international multiple countries cohort research project titled Pure Scientific. So this is groundbreaking research, and UK, I'm very proud of it, and been published in the Straits Times for the big input that bring up UKM's needs. It will give an eye-opening that nothing is impossible if you know what you want, how we should do, and organize our research. The important thing is about organizing your research. So now let us see how this can give you some solution for planning your research. So look at how the research will give an impact to us, our organization, and society. So because in population health, we are not looking only for our interests, but we are looking to serve our immediate societies as well as of the organization with healthcare delivery. Some research may find a hard time getting the research findings output as a key message to deliver and engage with people stakeholder. So let me show my showcase. So I involved in a consultancy research project with other members. So these are our members of this grant, and we get collaborations from Pakarunding. The grant actually is under Kementerian Pembangunan Wanita, but been given to us to Institute of Social Malaysia because it's social science. And we come up with the papers, and we publish in a Q1 papers, and we come up with a research project. We completed the research project, and we come up with a books for reference. So the book have been used by the Kementerian Wanita and others for planning on in terms of the LTC, which is long-term care for elderly. So so our survey findings, sorry, I have to present in Bahasa Malaysia because this is the thing that we present to the Kementerian Wanita and to guide them in terms of come up with policy about long-term care. So and we propose some models that we think that is suitable to in facing of year 2030 when we are known as an aged country. So we come up with many types and make the framework confused so that they will come back to us to come up with a pilot study in terms of testing our concept to come up with the long-term care at the community base. So finally, I think this is my last slide. Just one more. Yeah, time is already 11:25. So outline the social ecological model is one of the theories that normally that we use in population health. Because in population health, we're not only interested on individual patients in front of us, but we are looking on population in a bigger group behind the 1% in front of us. So normally we are looking into order from micro, meso, and macro level. So the macro level is more on the organization, which is healthcare delivery, a policy in terms of planning and monitoring of the programs. So whatever that we come up with the research, normally we try to angle in terms of the indicator performance. So our indicator performance always been measured in the public health department in the Kementerian Kesihatan. So we help them, we collaborate with them so that we can give some input from our university level for them to measure and report in their report yearly. So I think that is my last slide from the population health group. So I think that as a researcher, we need to keep going. Even though we may fall down, we need to get another alternative ways. There's no such a nice highway. Sometimes we need to swim, we need to use some boats to go to reach our goal. Yeah, so basically in population health, we are dealing with data integration. Normally we love looking on the data, even though like clinician looking on the patient as a comprehensive assessment, but normally as population health researcher, we looking not only a patient, but we also support and link with other data and looking at a bigger contact in a macro level, in meso level, so that we know better our population. So from there, we try to stratify, come up with a good design so that we use our data as evidence. And normally we use a tool that is validated. So if you are students out in our department, number one question that we ask is, are this tool validated? Yeah. So and the idea is, normally we always reflect that the output of this research should have beneficial to healthcare delivery, so that it can improve into our planning and monitoring. And we don't forget that we get the fund actually is direct from committee. So we need to serve back. Sometimes when we do research, we do a community services. So we go down to the grassroots and meet them and provide whatever service that we give. Normally we do a health promotion camp. And then through that, we get some feedback, how that make sure that our research can be sustained. So from there, we help in terms of add on evidence for the better reference. With that, I think I thank you and I pass back to Prof. Haikal. Thank you.
Yeah, thank you very much, Prof. Rosna. So for the presentation, so we move to the last showcase for today's symposium by the Tissue Engineering Group, led by Associate Professor Dr. Angela Ong-Min-Hui. Okay, so Dr. Angela obtained her bachelor degree in biotechnology from University of Malaysia. He received a master's degree under the supervision of two distinguished pathologists, Prof. Louis Laming and Prof. Chia at University Malaya, studying the association of telomerase and telomere length with cancer aggressiveness and cell immortality. And she was integrated by the similar expression of telomerase in proliferating stem cell that underlie a body reparative and regenerative capability. Okay, this led her to pursue her PhD in tissue engineering and retinal medicine under the guidance of Prof. Rizma Idrus. Without further delay, I would invite Prof. Angela to present here the group research study activity.
Hi, Dr. Haikal, and good morning, everyone. Can you hear me?
Yes, yes.
Right. Okay. Let me share. Okay, I'm glad I'm given the last slot because this was all prepared quite last minute. All right, so I shall start with the corporate video rather than ending with it. So please enjoy.
The Research Center of Excellence in Tissue Engineering, Regenerative Medicine, Stem Cell Research. Tissue Engineering Center, in short TEC, is a center of research excellence in tissue engineering and regenerative medicine. Established in 2008 under the Faculty of Medicine, UKM. To improve quality of life. To provide cure for diseases. Training and education. Technology transfer. Clinical translation and commercialization. CGMP is the acronym for Current Good Manufacturing Practice, a quality standard that is internationally recognized as the best practice for manufacturing of therapeutic goods. It is a way to control the quality of the product throughout the process of manufacturing in order to ensure its safety and consistency fit for therapeutic use. The center has been focusing on deriving cells and tissues from patients and to cultivate and further manipulate these cells outside the patient's body and to be utilized back into the patients as therapeutic products. Various products have been developed in the center, including tissue-engineered skin, bone, cartilage, cornea, and so on. In the future, we will be focusing our efforts in translating these products in the clinical setting and to be made available and accessible to patients. More clinical trials will be conducted, such as Bluetooth for the repair of knee cartilage, My Bone, My Cornea for bone and cornea repair, respectively. We will also be focusing on our efforts in developing novel strategies using induced pluripotent stem cells and cell-derived products such as matrices, vesicles, and proteins. Skin tissue engineering was an initiative undertaken by the center in search for an alternative to split skin grafting. It is especially useful when patients do not have enough of their own skin to cover the large area of skin lesion, for example, in cases of burns and serious traumatic injuries. We have completed clinical trial phase 1/2A in 2016, whereby 15 patients have been treated. Graft uptake was 100% for burns and traumatic wounds. The healing was excellent and the final appearance of the skin was smooth with minimal skin contraction. As support by the founding of the center from the 2021 together with our former technical center associate of Dr. Angela, center will continue to strive to become internationally recognized center of research excellence in tissue engineering and therapeutic medicine. Continue pioneering the advancement and bridging our mission to improve the quality of life of patients and prepare, repair, generate.
Thank you.
So that corporate video was taken from the CETM, Center of Tissue Engineering and Regenerative Medicine. So let me talk about the research group. So term tissue engineering and regenerative medicine, or term in short, focuses on harnessing the self-healing and regenerative capacities of our body, and by understanding the integrative signaling pathways and incorporating solutions from stem cell or cell technologies, biomaterials, engineering, novel clinical approaches to repair, reconstruct, replace, or rejuvenate damaged or lost tissues and organs. That's mouthful, but in short, I would just highlight that it is all about regenerating tissues and organs using cell and material technology with the help of engineering and input from clinical approaches. So our research is very translation and sustainable focus. Translation meaning we have the output in mind before we initiate any research project, meaning we usually engage the end users, especially the clinicians, in understanding the problem in treating certain diseases, especially those involving injured tissues and organs. So with that in mind, understanding the problems or the current limitations, we would initiate, that's how we initiate a research project. Sustainable focus, meaning the theme on regeneration itself, it's about utilizing resources that is sustainable and regenerate, that we can reuse and regenerate. So in that sense, I think in this era, this theme is even more important as we aim toward a more sustainable way of research, and also tapping sustainable resources. For example, using wasted or discarded tissues and cells from the clinic. We are also multidisciplinary focused. As I mentioned earlier, that engaging the clinicians is essential before the start of any project. And alongside, we would consult engineers, for example, material engineers, in probably suggesting what would be the suitable material for tissue engineering purposes. We are nature inspired because much of this regeneration happens in nature. So we get the inspiration by looking how nature does its work. In our pipeline of research, we would like to enable a bench to bedside with solutions on the whole, pathway, meaning we have the ability to look, we have researchers focusing on the fundamentals and the applied side of the technology, and we will also involve especially the clinicians at the clinical trial stage, and the center has the capability of manufacturing many of these these products, including cell and gene therapeutic products. And in more recent years, we have been very actively engaging the industry to work towards a commercialization of our innovations. So I thought this is important to share a little history of the group. The group was founded way back in year 2000 by Dr. Aminuddin Saim and Prof. Dato' Uzima in the ENT department.
So we have a lot of gratitude towards ENT department for housing the research group at its initial years, and we established a society, the first society in Malaysia on tissue engineering, which is named Tissue Engineering and Regenerative Medicine Society of Malaysia, or in short TESMA, in 2004. It was later being recognized as a center of research excellence by the Ministry of Education for UKM in 2008. And eventually, with that, we were also allocated a fund to build a GMP facility for cell and tissue processing. And with that, we had to be relocated to the 12th floor of the clinical block today. And the construction of GMP took almost 2 years and was completed in November 2011. And since then, we have ran a number of clinical studies and completed a clinical trial. So that's a brief history. I would probably clarify the relationship of TERM with the center and also the society. So TERM was the research group that was initiated, as I mentioned, in 1999, and we have been engaging clinicians since then. And from our website, the SPI website, you can see that we have 55 members, and there are probably a number of members more. The only limitation was some of them were also involved in other research groups, and so therefore some of them couldn't choose our research group as one of their research group. So these are the 55 names, and we have also listed the research niche here, and you can look at their publication from the various databases. So we have, within the group, we also have postdocs and also science research officers, including PPSP. So that's, and TESMA is a society, is a national society that we encourage all members of TERM to join. It is the subscription fee is very minimal. I think it's only 50 ringgit for professional and 20 ringgit for students. It has to date 150 members across the nation. This is where we can interact with researchers from various institutions across Malaysia. And you can also look at its website, and it would have its own run its own activities as well. So as a member, there are many privileges, and the society also run its own journal, Regenerative Research, which you can submit to. And CTEM as a center of excellence, as I mentioned earlier, it was located. It is located on the 12th floor, so it is a physical facility, and so members of TERM can be part of CTEM, or they can opt not to be affiliated. I mean, an associate. They can apply to be an associate research fellow with CTEM. However, being associated an associated fellow of CTEM would mean there are KPIs that you have to fulfill. But otherwise, being a TERM group member, you would have be recognized as an internal researcher, and you would have access to the many facilities in CTEM, either without charge or sometimes with machines that are very cost costly to maintain, there will be a minimum charge to you. So in 𝐶TM, we have 14 members that include science and research officers. We have nine PIs, 9 research fellows to date. One just graduated from her PhD last month. So now we have 9 now, and the others are office science and research officers. And we have approximately 70 active postgraduates in the center. They could be postgraduates that are registered with TEC or in other departments, but attached to 𝐶TM for their research project. And you can access the 𝐶TM website, and you can they would run their own activities as well, and with many more services and training made available, in fact, to all. Okay. So how I see 𝐶TM group is me being a moderator in recruiting more, or to convert more academician into full-time, no, not full-time, into PIs one day, so that they can apply their own grant and be part of 𝐶TM, at least as an associate research fellow. So that's the function of 𝐶TM, and we actively also recruit of science and research officers because we think that they are also a very crucial part of our research activities. So 𝐶TM would be a feed towards TESMA and also 𝐶TM. In terms of research collaboration, we widely collaborate across departments and also faculties. So these are some of the research collaboration that are currently active. We have quite a number from the surgical departments. And in terms of course, with the research collaboration, we would have LOU, MOU, or project agreement or research agreement signed. And this graph here captures also some of these agreements signed with international collaborators and also industrial collaborators. And the group has filed quite a number of patents to date. Some are still at the filing stage, and quite a number has been awarded. Here you can see 4 has been awarded to date. In 2018 and 2021, as you can see, 8 patents were filed. And the facility in 𝐶TM has been certified with the quality standard ISO 9001 and also 17025 for running a number of testing on cells. So we can explore that. The hope is that all research that is conducted in this facility meets the international standard. And as a center located in the clinical block itself, we actively collect discarded tissues from the operating theatre. This has been approved by the ethics committee, and we isolate primary cells, which are very valuable in medical research. So please, if you are looking for primary cells, something closer to the clinic rather than cell lines, please contact 𝐶TM, and they would probably work towards a certain discount for internal researchers. And apart from being a primary cell and tissue bank, 𝐶TM also has got a research facility not only in on the 12th floor. There are animal facilities that has been established with UPM for sheep, in UKM Bangi for sheep and monkey. There's also a surgical theatre that we maintained in UKM Bangi Animal House. You can see the operation being performed in Bangi on monkeys and sheep. And on the 12th floor, we do house a small animal facility for rodents. As mentioned earlier, 𝐶TM also houses 3 clean rooms, and they are certified to be clean room that under the scope of cell and tissue processing. So with this compliance, researchers can come to us to contract manufacture their product for clinical trial or commercialization purposes. So these are 2 examples of products that we have manufactured in the clean room. One is skin, the other one is this is engineered skin, and the other one is engineered cartilage that is to be injected into the knee. And some of the commercialization initiatives that have been initiated are collagen patch for as a wound dressing, and bone constructs as bone substitutes, and also using secreted proteins isolated from cells for turning them into topical products. And 𝐶TM runs actively runs a postgraduate program and welcome interns and attachment students. All right. So there's music now. Okay, I'm using a template that probably has got a bit of animation. All right, so I would go into introducing the researchers. I think same as the earlier. Yeah, I didn't realize that the template has got a video. I'm so sorry because we didn't play it earlier. So I had to do it in this mode. Okay, my apologies, because otherwise the video will run on its own. So I will just introduce the current the PIs with current research titles. There are many more researchers in the list, but because they probably are not the lead for the project, so I will not highlight them. But they are, and some of their projects has completed, and they are in the process of applying new ones. I will just highlight the current the PIs with current research titles. This is Associate Professor Dr. Muhammad Fauzi, who is also the head of 𝐶TM now. He leads the Functional Biomaterial Technology Program, and these are some of the titles that, of research that he is working on. He's very much into collagen, using ovine collagen to give and making them into hybrid material for cutaneous engineering or as wound dressing material. That's me. I started off doing a lot of neuromuscular skeletal engineering. As from the title, you appreciate that I work very closely with the orthopedic counterparts. And my personal interest is also very much into bioenergetics, looking at how we can harness the energy from mitochondria. These are some of the project titles that I'm running currently. So I'm involved in tissue engineering of bone, mesenchymal stem cells, using mesenchymal stem cells for therapy, and also working together with the orthopedic surgeons on nerve conduits fabrication. And this is Associate Professor Dr. Yogesh Warren. He's into airway bioengineering. So therefore, he works closely with the ENT surgeons and with a focus on stem cell therapy. And these are some of the current titles that is running on. As you can see, maybe I'll just highlight one that is working on using even natural products for spinal cord regeneration. And Dr. Fazlina is also our senior research fellow here in CETM. She leads the induced pluripotent stem cell program and also viral vector technology program. And these are some of the project titles that is running. So the highlight would be using iPSC from patients to generate to differentiate them into certain tissue line or certain cell line to study disease development. One example is this, where the cells were taken from, the fibroblasts were taken from patients with mitochondrial defect. These are patients with a genetic problem where their mitochondria is defective, and using the fibroblasts from them, we were able to induce them into pluripotent stem cells, and from there we derived neurons from this patient and look at how their neurons behave. And the potential is just huge using this technology. Next, we have Dr. Daniel. Dr. Daniel started with tendon bioengineering and is now very much an expert in driving exosome therapy. These are the research titles that is running now, and a lot of focus is on the upscaling of MSc so that we can have a sustainable source of extracellular vesicles or exosomes for therapy. Next, we have Dr. Dain, who leads the Integrative Cell Signaling Program. These are the titles of his research, and he also collaborates across department. For example, the one on vagina agenesis is with the ONG department. And the one with vascular research is with the surgical department. Then we have Nadia. Nadia Sulaiman leads the cardiovascular bioengineering program. And therefore she works with the cardiothoracic surgeons, closely with them, and she currently heads an international grant, the Newton grant, which allows her to collaborate with researchers in the UK, which is very successful. Next, we have Dr. Manira Ma'aruf. She heads the cutaneous tissue engineering and secretome program. These are some of the research titles. The topical solution using secretomes from fibroblasts is that I featured earlier as a commercial product, was a product of her innovation. Then we have Dr. Atika, who has just completed her PhD
she will be heading the proteomics and bioactive compounds discovery program. And her study, it's about neurodegeneration. And in her PhD, she works on snake venom and looking at the different bioactive compounds and how it works on the neurons. Just to feature some of the product that we have translated, as I mentioned earlier, 𝐸𝐞𝐚𝐥𝐿 or 𝐸𝐷𝐻𝐿. This was headed by our founder, Professor Rizima, who now acts as our advisor for 𝐶TM. So this product has been has completed phase 1 and 2, and a spin-off company was incorporated to commercialize 𝐸𝐷𝐻𝐿. And now we have Prof. Hamdan and Dr. Rizal from the orthopedic department driving a phase 1/2 clinical trial using stem cells derived from patients to be injected into the knee. This is enabled by the Lab to Market grant. And we have Associate Professor Dr. Nur Hazla from Orthopedics Department as well. She's the PI to quite a number of research on bone and also nerve. Next, we also have Associate Professor Dr. Shalima from Orthopedic Department, again heading a number of research projects on nerve regeneration and in her study, she fabricated a novel synthetic nerve conduit that has been patented. Then we have Professor Muhammad Yazid from Orthopedics Department as well, who works on using stem cells from patients for diabetic ulcers. Previously, I worked closely with Dr. Yazid on developing a kind of bone graft, and in fact, we have run 2 clinical. We have used this bone graft on in 2 clinical cases, and a patient recovered wonderfully, and we are now exploring grants with the industry to run the clinical trial. Then we have Dr. Ikram from Biochem, and these are the research titles, and I collaborate with him on these 2 projects on bone using nano HA for treating bone fracture. Earlier on, if you were here in the first presentation, Associate Professor Dr. Wan Haslina works also closely with 𝐶TM on these various titles. One on the retinal regeneration, cell regeneration. The other one is this contact lens cultivated limbal epithelial transplantation, which she has patented. And now we are looking at the potential of securing grants from the industry. Then we also work with Prof. Jemima from Ophthalmology Department, and again using contact lens as a potential scaffold for ocular engineering. And we have Dr. Marina, and this was a previous study with us, that currently with the project headed by Dr. Mawada, which I didn't have the title in time. So anyway, they are running projects related to ENT research. Then last but not least, we have our chairperson here, Muhammad Haikal bin Muhammad Yunus, and he He currently has two research projects with us. One is funded by FRGS and the other one by GUP, looking at cartilage, looking at OA cartilage, their signaling pathways. Okay, so I think with that, that's all from term. In fact, they have so much to explore from the website itself. But if you have any inquiries and you would like to explore collaborations or even just to brainstorm your ideas with us, please contact me. These are my contact details. Thank you very much. Thank you, Dr. Heidi.
Yeah, thank you very much, Prof. Angela. So thank you for the precise presentation. So I think this is the end of the showcase and the symposium for today. So we really hope that I hope that you have found this symposium is very informative and useful. So thank you for spending time with us today. So and don't forget to join us again in the next session, okay, for poster presentation tomorrow and also morning coffee with a distinguished speaker. All right, for that, I thank you everyone.